Welcome to Nutrium's first international event, Empowering Nutrition Professionals, the Digital Era. This is an online webinar that will empower your performance as a nutrition practitioner within the digital platforms. Thank you for joining us all today. My name is Sarah Achleithner, and I'm your host for today's webinar. I am Nutrium's country manager from North America, and I am very excited to introduce Nutrium to the American market through partnerships with associations, influencers, and universities. I have my bachelor's degree in nutritional dietetics from the University of Nevada, Reno, and I have been working in the nutrition space for over 8 years. I've worked with dozens of award-winning nutritional professionals doing website management, SEO optimization, event coordination, nutrition analysis, graphic design, ebook creation, and writing articles. Because of that, I have a broad understanding of nutrition and what it means to run a successful online business. I also have a passion for all things food, fitness, and travel. So I love that the nutrition field can combine so many of these things. So now that you know a little bit about me, I'm going to briefly go over the outline for our webinar today, as well as cover our giveaway information and go over a nonprofit organization called Helpo. Our event today will provide you with the digital skills you need to jump into the online world and allow you to run a more efficient and successful business. You will be able to take your business to the next level, all while enriching your knowledge in areas such as communication and marketing. And we will also go over the use of the latest technologies to make your practice stand out. In this webinar, we will be covering the following topics: nutrition through time, both before and after the pandemic, leveraging technologies to build a thriving nutrition business, how to enhance your communication and marketing skills, as well as working as a remote nutrition professional. Our experts today will be going over the latest trends, the best digital platforms to make your work life easier, ways to improve your communication skills, how to get more clients and retain the ones you already have, as well as how to make a big buzz on social media and other platforms. Since we want this to be an impactful event for you, we will give you the opportunity to ask questions and participate in a discussion at the end so you can get the best tips personalized to your own situation. Before we get started today, we want to remind you about our giveaway. While donating to Helpo's mission, you will become eligible for one of the 3 cool prizes. The first prize is a combination of AirPods and Nutrium's license. The second prize is a telehealth toolkit and Nutrium's license. And the third prize is an Amazon voucher valued at €100 and Nutrium's license. Please note that the 3 Nutrium license we are offering are annual, both for the follow-up package and for unlimited patients. Don't forget to check out our website for further details. So if you want to join the giveaway, follow these 3 easy steps. You can complete the registration process with the same email that you used for the webinar registration. Then you can donate to Helpo with this information we have here on the screen. And once you have that, you can send a confirmation of the donation to partnerships@nutrium.io. Before we get started with our webinar, I would like to tell you all a little bit about Helpo, as well as thank you all for who have kindly donated to this organization. Helpo is a nonprofit organization that aims to provide support to the most vulnerable populations in countries with a low human development index. They do this by raising awareness among funders that allow the implementation of programs and projects in the key areas of our intervention. One of their projects is called PONME, which is a maternal child nutrition follow-up program. It's being established in Estocolm and Principe with the cooperation of the country's Minister of Health in their national nutrition program. PONME's main goals are to improve maternal and child nutritional health, reduce infant mortality rate, and promote good nutritional habits and food security. The way this is done is by targeting mothers and children from 0 to 5 years of age who have chronic and/or acute malnutrition. They also target children at nutritional risk, such as those with chronic illness, orphans, or children from teenage and alcoholic parents. This project undertakes many different activities, and one of them is the follow-up of malnourished children. Every week, malnourished children go through a very detailed follow-up by Helpo's nutrition professionals and other affiliated health partners. Another thing they do is offer technical and food support for inpatient nutrition rehabilitation. Helpo also has a mobile health team. The team in this field is responsible for screening children under the age of 5. They also have nutritional counseling for caregivers, as they have sessions with the mothers about nutrition in order to help them improve their nutrition-related habits. Helpo also offers continuous health training with the health team. This team is responsible for training the local nurses, doctors, and other medical staff. Helpo also offers the support of families via donation of food and other items, as well as community cooking sessions, which are aimed at educating the communities and mothers regarding proper feeding of children under 1 year old. Helpo also offers support of health infrastructures with the renovations and donations of anthropometric material. And lastly, they also offer internship opportunities as they receive Portuguese students that want to be a part of the program. This project began as a localized initiative. Helpo began their work in one of the country's districts and has since expanded to the national level. So let's go ahead and talk some numbers. So far, they have monitored 67 communities with an average of 115 children being monitored. They have 427 mobile health teams, and they've already done 14,511 nutrition follow-ups and assessments with 86 inpatient care. And they also have more than 400 children recovered from malnutrition. So in case you haven't already, be sure to make a donation via our enrollment page. You can trust that your donations will be making a huge difference in someone's life. And now, without further ado, let's go and hand it over to our first speaker of the day, Margarida Beja. We are also going to have a poll for each speaker, so feel free to participate. So Margarida Beja started her career as a nutrition professional 4 years ago in Portugal. She moved to the UK in 2017 and is currently working as a critical care dietitian at Southampton General Hospital. Margarida is very passionate about providing nutritional literacy and sharing evidence-based information. She does this on her Instagram page and podcasts, where she regularly posts relevant information about health, nutrition, and eating behaviors. Today, she will be talking about nutrition through time. So go ahead and take it away, Margarida.
Hi, everyone. Thank you so much for this opportunity. I'm very pleased to be here today to talk about nutrition before the pandemic and after or during, because we're still living such a difficult and unpredictable moment. So as you said, Sarah, thanks for your presentation. I studied in Portugal, in Lisbon. I've got a degree in dietetics and nutrition, so I work as a dietitian. I moved to the UK in 2017, and I'm currently working as a critical care dietitian. It's been such a challenging time. This is also my first year in critical care. I also have a special interest in eating disorders and gastroenterology, because I love the acute side of dietetics, but I also miss the public health side of things. Therefore, I've got an Instagram page where I like to explore all different topics. I also have a podcast, which is done in Portuguese. So I'm sorry to all people listening here that are not Portuguese speakers. I've got an episode in English, so feel free to listen. It's about intuitive eating. But anyway, that's not the reason why I'm here. Aside of this, I also have my private practice, and I do some one-to-one clients. Today we will talk about nutrition evolution throughout the time, what changed during the pandemic, and what we did to adapt our practice and to make sure we provide the best care. So in the next slide, I've got a bit of an evolution. We know that nutrition has many, many years. However, modern nutrition is actually something really new and really recent. Early 90s, we discovered vitamins, and from that time we started some research in that area. Things have been developing throughout the time. 60s, we had industry and food fortification, which was something that helped us to fight many diseases that were related to micronutrients deficiencies. Later on, we started, or we developed even more research with chronic conditions, and we developed dietary guidelines. And this has been changing over the years. Obviously there's a lot of things that we still don't know, and nutrition is a science, it's dynamic, therefore there's a lot of questions that we still don't know the answers, and that's what makes this even more challenging, and that's why I love this area so much. So new century, we face different challenges. I think specifically for this year 2020, obviously the pandemic changed everything in terms of our practice. What I think is the main trend and the things that are changing a lot in nutrition is specifically related to gut microbiome. It's an area that we are knowing and getting to know even more, and we know that in the future we will have more answers. And also we are even more exploring the psychology behind eating, which we've been studying, but I think nowadays we are focusing on that area much more, and I think that's a massive difference we've seen during this past 5 years or so. So in my next slide, I will go specifically to what has been changing since we started this whole COVID situation. It's been such a difficult time. We still don't know when this will end, and we are still adapting our practice to make sure we provide the best service we can. So as I said in the beginning, I work in the acute setting. So I work for the NHS in a critical care unit. I can give you a bit of an experience of my experience. So we are still changing the way we work on a daily basis, because things are changing a lot, and they will change in the future for sure. So there's a lot of changes in the dietetic services. Obviously, this is different between different countries. We see a high demand with hospital admissions, increased number in ICU patients. For those who don't know, we dietitians work in critical care. We need to provide nutrition support for these patients, but it's such a specific area of nutrition that we had to train up other dietitians that usually don't work in critical care to be able to see everyone. Also, there's a lot of resources that are not available at the moment, feedings and medications and lots of things that obviously made us think of how we can carry on providing a quality service with what we have. In terms of staff, as I mentioned, there's a lot of differences before the pandemic and after the pandemic. There's a lot of colleagues that are doing critical care or other areas that they usually don't. And it's been very, very, very challenging. In the community, we see something similar. There's a lot of appointments that are being cancelled because lots of people, doctors, nurses and other health professionals are being moved to work in the acute setting. Obviously, virtual and telephone clinics are now a reality, and that's something that we will talk about during this webinar. It is interesting because for the NHS, for example, although we used to do phone calls, we didn't have such a setup of virtual clinics, which was very, very difficult to start from the beginning. And also remote access was not a reality for the majority of the health professionals that are working in this kind of setting, because there's a lot of issues in terms of data protection and confidentiality, and that's something that IT services had to work a lot to be able to face the challenge and fight this situation. In a private setting, as I said as well, I do some face-to-face clinics. I see private clients. It's very interesting because I carry on seeing patients. Since I moved to the UK, my private work has been remote, and I've been using Nutrium for the whole time, and I think what you guys did in terms of changes is great, and we will talk about that later on. What I think from a private perspective, I think there's a lot of changes on clients' priorities and reality, whether they want to carry on focusing on their diets or not, or they want to set a different priority in terms of health, or for other reasons they want to focus a bit more on their diets and they want to improve their health and contact nutrition professional. So there's a lot of changes, especially in the dynamic within the communication and the way we carry on our private clinics. So obviously this all requires virtual appointments, and that's something that can be really, really challenging, because I think there's nothing better than the face-to-face communication where we can see our patients, our clients, and communicate in a different way. We will focus on that later on. In terms of workload, this is something that obviously there's a question mark there, and there's a reason for that, because actually in my example working as a acute dietitian, obviously the demand is much higher. We have a lot more patients in the hospital. However, some colleagues, nutritionists and dietitians that work in the community or in the private setting might face decrease in their clients, some people are not coming to their appointments or not attending. It's easier for clients to not show up if it's a virtual thing rather than attending physically to an appointment. So workload can change massively between different professionals and depending on the setting that you guys work. In my next slide, I've got some other changes. So in terms of communication, obviously everything now is video and telephone appointments. I think for some, even we have still have some face-to-face work. Obviously there's still some patients and clients that need to be seen face-to-face, but we have masks. And I don't know if you guys feel the same, but I think it's completely different to work in a mask. We don't share the same, we have our expressions that are not, people don't get the same information. I personally find it quite tricky to communicate with my patients when I have a mask. And also in terms of empathizing, sometimes you don't need to say something, your expression tells everything. And I think the mask is such a big thing. I cannot wait to have a normal life wherever and whenever that will happen. So in terms of follow-up timing, I think that was also affected because we have a high demand of clients and patients in some areas. Therefore, we had to extend our follow-up timing, which can be tricky for some clients that have a specific health condition that needs a more close follow-up. Obviously, in a clinical setting, for example, for oncology patients, this actually has changed, and the fact that we ring patients more often, sometimes this can be a good thing that happened in a way that we are more prompted to ring the patients and keep like a close follow-up. But obviously that changes, and I'm very happy to hear your experiences because I'm sure there's different feedbacks on that. I'm sorry. Let me just, because now I receive a call. Where is that again? Sorry. Sorry, you can share again because I'm okay. Here it is. I found it. Sorry. In terms of anthropometrics, this is something that obviously has changed because we are not able to check our patients' weight, our patients' anthropometrics measurements the same way, not only because we're not seeing them face to face, but also there's, in terms of the COVID situation and in terms of protecting ourselves and not touching patients, obviously when we're talking about face-to-face appointments. However, I have to say there's many healthcare professionals that are now following a non-weight-centered approach, which is great because if you think about nutrition a few years ago, we were very focused on dieting, on checking patients' weights and focusing on certain things that we are now kind of changing a little bit and focusing a bit more on healthy eating behaviors. And obviously there's other areas where checking weight is actually really important, despite the fact that we are talking about weight management or not, specifically for example, oncology patients or patients that need a different approach, and we need to check their weight to make sure they're having a good nutrition and improve their health outcomes. And dietary, obviously food habits, people change their food habits so much. They are in the house much more. There's a lot of food insecurity, whether we will have food and whether we will be able to buy what we need. The family dynamic and household changed as well. There's a lot more people in the house or not. There's some people that experience some a different dynamic or being by themselves in the house. And that obviously has an impact on their food routines. There's different meal times. People don't eat at the same timing. There's the social side of things that is a bit compromised at this stage. So there were a lot of dietary changes, and obviously that is very different depending on where you are in the world, your previous habits and what you have right now. And then my next slide, I have still a few other things that have changed, some topics. Lifestyle. We are all, or I am not working from home actually because I work in the hospital, but there's a lot of people working from home as health professionals and our clients. And that obviously changed the whole dynamic. If you think about, and that happened a few times, like you are giving an appointment, like you are in a session with a client and there's someone coming in, obviously that doesn't happen very often, but that can change the whole dynamic. It's kind of I sometimes feel like we are stepping into a stage that this is our private area, and that can change our dynamic with clients and the way we communicate. I don't know if you guys agree, but I personally think this is a massive change. And also it's difficult to have a gap, or not have a gap, but there's a separation between what is my job and my private environment, if you want to say. Also specific for our clients is a lack of physical activity, but that's not only for them, that's for everyone. We are much more in the house and doing less exercise. People don't sleep very well. There's a lot of stress going on, and lots of questions about our future, which obviously affects the way we see life and our stress levels. Economical aspects, especially for a private setting, if we think about, there's a lot of people that lost their jobs. There's a lot of people that are managing their financials in a different way. Can clients still pay our nutrition appointments? That's something that we don't really think about that often, but that's something that definitely this pandemic has changed, and that had an impact on our income and our practice as well. And as I said before, food insecurity can also have an impact on our practice and the way we develop our plans, the way we communicate with our patients, and so on. And in terms of mental health, of course, we have a variety of different situations. I can give you an example. In hospital, we see an increase in number of eating disorder patients coming in. There's a lot of issues around food related to this pandemic. The fact that people are in the house much more often, dealing with themselves, dealing with a different dynamic with their families, that can affect, and that can be a trigger. People are stressed that use food as a way of comfort. And I've got a lot of people that come to find me to get some help in terms of controlling their binge eating disorder, or like exploring their relationship with food, which is great, because I think this was all an opportunity for people to reflect on their mental health, and specifically for eating disorders. I think this is something that I've seen a lot in my practice. Dealing with a difficult situation can affect us all in different ways. And that's something that I've seen in my practice as well, the way that people are experiencing this situation in a different way, and that can impact their engagement with the plan, their eating habits, and so on. And as I said before, family dynamic and isolation can have an impact on what we do and the way we do. And last but not the least, I think we are health professionals, so we need to look after ourselves to be able to look after other people, because we're all living in a pandemic. So it's not a question that clients are experiencing this, but we are here and we're not living the same situation. Obviously that doesn't happen, and sometimes I do struggle to carry on with my practice facing the challenge that we are all facing, and this is really, really hard. And just to let you know that it's okay to feel a bit overwhelmed, but we need to look after ourselves in order to be able to look after our clients and help them in the best way. So in the next slide, just to talk about a bit this uncertainty and the way we plan things. And I think this is something that I've reflected a lot during this pandemic. In a normal life, and especially in the UK, I can tell you guys, there's a lot of protocols and we have rules for everything, which works great in a majority of the situations. However, during such an unpredictable time, we had to adjust things various times. I had periods where I came to work, and today there's a plan, tomorrow there's a completely different plan. And I think this is a great opportunity for us to reflect on how we adjust our practice without having a plan. Because today, as I put in this slide, we have a plan A. Tomorrow, plan A doesn't work anymore, so we need to think about another thing, and that needs to be done quickly. The day after, that doesn't work anymore, we need to go back or think about a different plan. So this is something that we need to reflect, and sometimes we don't have a plan, but we need to think quickly, but we need to think wisely, because we're dealing with people's life and people's health. Therefore, we need to think carefully in terms of what we can do to help them, and how the change on our practice have an impact on people's health. So in my next slide, also I wanted to talk about social media. as I said in the beginning, I have a page on Instagram where I explore different topics. I think this was also a good opportunity to reflect on what kind of topics are we talking about. Do people really want to know about the diet A or B, or do people really want to know more about food insecurity and how they can, keep themselves healthy during a pandemic, during a time where they're not that active, the time that they probably eat more. So it's thinking about the kind of topics we talk and think, is this what people really need to hear now? And that's something really challenging, because I sometimes come up with a topic and I think, is this really relevant for now? So that's something that we need to reflect on a daily basis. I also think this is an opportunity to develop our practice and share our services, because people are using social media much more than before. Obviously, I don't have any data, specific data, and this is something that we are still collecting, but I believe that people are using their phones much more. So this is a good opportunity for us to share what we do and how we can keep seeing patients and clients without seeing them face to face. But actually, this can also be an opportunity to develop our practice in a different way. Can we have groups? Can we have webinars? Can we develop podcasts where we can share our knowledge and help people in a different way? That could be something to think about. And the other thing, and like the not so easy side of working remotely and exploring these topics, is something related to data protection. So how do we keep seeing patients and clients remotely and protecting their data and confidentiality and making sure we've got everything in the software that protects that? That's really important. How do we keep effective communication with clients? Obviously, as I said, I think for me personally, face-to-face is really, really important, and there's nothing different. There's a lot of non-verbal cues that we need to be paying attention of. However, I think we are all getting used to this way of working, and actually video calls, there is a difference, but I guess we can still feel and have similar feelings compared to what we have on a face-to-face basis. We just need to adapt ourselves and carry on with what we do in the best way we can. And also, another thing that we had to think about in the beginning of the pandemic is how can we easily implement something different. Because usually, and we can think about the vaccination thing, this is something that we need time to plan, but now we don't really have that time because we need to carry on working and helping people, and we need to make sure we have an easy plan and something that is easy to start from now. In my next slide, just checking if I'm on the time. So we did a survey, and Nutrium had a survey with healthcare nutrition professionals, and this is a bit of the results we had. There was a decrease in appointment attendance in 50%. This is a massive number, and there's a lot of consequences, not only for the clients, because they don't get the follow-up they need, they don't get the care they need, and there's something that is there's a care that is broken in a certain stage, so there's no continuity, but also there's a consequence for us that we don't have the same income. In terms of employment, lots of people are now unemployment, which is such a difficult situation, not only in nutrition area, but many others. And there's a lot of people working in layoff. So to fight this new reality, there were a lot of things implemented in order to carry on seeing our clients, online appointments, investment in marketing and social media. I think that has a massive importance on that, and I'm sure we will talk about during this webinar much more and in depth. And new services and dynamics, webinars. I've seen lots of colleagues doing webinars, and that's another source of income, but also a way to provide relevant information and different topics that are perhaps a bit more interesting for this stage and what people are looking for. And there's a slight increase on online payments, and that's something that I think it's obvious considering the current situation. And in my next slide, I've got what Nutrium has done to fight this situation. I've been using this software since I started doing my private clients, and that was since I moved to the UK, because I carry on seeing some clients, especially Portuguese speakers. So the things that were done in order to change and make sure we get a different and better practice were online booking and scheduling. That sounds a bit obvious, but makes our lives so much easier. Making sure we have a video call that we can book in the moment we book the appointment, because we sometimes are so busy that actually scheduling the appointment and then booking another appointment in another platform like Zoom or Skype, sometimes it takes time, and it's another task we have to do. And what I find that is amazing, like when you book an appointment with someone, you can actually create the link straight after, and it's sent to the client. You've got everything on your calendar, which is great, and it's really, really useful. You can track clients for diaries, which for some people can be really, really helpful, and you can see what people are doing, obviously with consent. So I think that's another thing that is really, really important. Things were done in order to be compliant with the policies we have around the world. So that's really, really good. And also the professional app has been a great, great tool. I think clients love that. They can communicate with us much easier. We don't need to give I do give my email, but it's so much easier to communicate that way. And I know you guys have done great work in order to improve that app and make it easy to access and to communicate with our clients. And then clients can do their payments, and there's the Stripe tool, which is also very useful. You can get your the payments really easily, and I think that's also a great thing and very useful considering what we're doing right now. And my next slide is just to thank you. Thanks for listening, and I'm really excited to see what this webinar will bring us, because obviously we're all in the same page and we all benefit from what we're talking about today. So thank you.
Okay. Well, thank you so much, Margarida. That was really great. We actually had one question come through during your presentation. So one person asked if you know of any reputable papers which reports the impact of video call consultations from the patient's point of view and practitioner.
To be honest, I don't. I haven't had a proper look into it. I think a lot of research in terms of the impact of our practice is still in progress, because this is such a recent situation. Obviously, I don't have any data. I can look for that as well, because I think it's something that I need to know in order to adjust what I do. But I guess there's a lot of changes, but I personally don't know any specific data. If you guys know and want to share, I'd like to have a look as well.
Okay. And then one other person just made a quick comment during your presentation, and she said that she is a mental health dietitian and her workload has already continued to increase during the pandemic. So very interesting to hear about that.
I definitely think mental health and people's relationships with food has been an issue even before the pandemic, and we are facing, as I said in the beginning of the presentation, there's a lot more focus on that, and I think that's completely necessary, and we nutrition professionals need to keep on track on that and kind of leave some things that we are used to work on and focus on mental health. But I definitely think that the pandemic was kind of a trigger for eating disorders and disordered eating, so problems that were already there but that they were triggered by uncertainty, the lack of control. So I completely share that point of view. There's definitely an increase of demand in terms of mental health, specifically related to food.
Right. Okay, well, that was all fantastic. Thank you again so much, Margarida. That was great.
Thank you.
And then someone also wondered if you could just share your Instagram handle one more time.
So it's interesting because it's a Portuguese one, so it's Embanho, so EMBANHOMAREA. I think you guys can share it. It was in the beginning, but we can definitely, I don't know if there's a slide, but in the end you guys can do it, can you? I think it would be easier.
Okay. Well, if any of you guys out there watching this webinar have any questions, please go ahead and just enter them into the Q&A box so that way we can see them and answer your questions and try to get to as many as possible. One more that actually just came through, Margarida. Do you have any advice for nutrition professionals who are now entering their practice or just starting their practice?
I think this ability of knowing that things change, not only during a pandemic, and what we've learned in uni and what we've been learning can also change, and we need to keep on track and carry on studying. So as I said, nutrition is a science, so we need to carry on and progressing into research. But also, like people ask me that question very often. I think confidence will come with practice. That's all I can say.
Okay. And then another question that came through was, how was your transition to be a registered dietitian in the UK?
I think this is, people ask me that very often, and I'm not sure if this is the right place to talk about it. It was, I can definitely talk about that in a different situation, because there's a question that I get asked a lot, and it's probably not relevant for everyone that is listening this now. Right. And we're focusing on other topic if you guys are okay with that.
Okay, well, that sounds fantastic. Again, thank you so much, Margarida.
Thank you.
Go ahead and transition over to Mariette, but again, thank you so much. That was really great to hear from you. Okay, so now we're going to be moving on to our next speaker, Mariette Abrams. Mariette is an award-winning registered nutrition professional, business consultant, and entrepreneur with over 20 years of experience in the field. She is a leader, regular public speaker, and a published researcher on the topic of personalized nutrition and health. Today, she is talking all about leveraging technologies to build a thriving nutrition business. So go ahead and take it away, Mariette.
Hello, good morning, good afternoon, wherever you are. I'm just trying to change my slides here. Can you all see that? Are we good, Sarah?
Yes.
Fantastic. All right.
Yes, we're good.
Fantastic. Thank you. Well, thank you for the introduction. I'll start briefly with my background, and I think it's a great introduction that Margarida also done, and actually will cover some of that video consultation question that came up. So just a little bit about me. I am a registered dietitian. I've been in practice for just over 20 years now. I've had an amazing journey. Started off in clinical nutrition. I worked in the UK as a gastroenterology and nutrition support dietitian. And then I ended up working in the medical nutrition industry as medical and scientific affairs manager, and then became an entrepreneur around 2012. Since then, I've been completely working for myself, an independent consultant, and I've recently become the CEO and founder of Kina. So that was kind of the formalization of what I was doing. And so we like to say that we are a niche consultancy that help businesses navigate and create in the emerging area of personalized nutrition. And since working in the clinical arena, then transitioning into medical nutrition, that's really piqued my interest in the potential of technologies and how we can use technology not only to disseminate information, but also how we can reach more people. And that's really how I got hooked on this area, or this emerging area of personalized nutrition that is enabled by technologies. So over the course of my career, while I have a degree in nutrition and dietetics as my first degree, I also then decided to go a little bit sideways and get a business degree, and then in the end got my PhD as well. And so that's given me a really broad perspective on not only the nutrition science and how nutrition is evolving, but also what are the potential and opportunities are for nutrition professionals within an industry situation. So, in a recent report by Lifetime, they reported that 81% of consumers are making health a priority this year. This really means that consumers are really looking for solutions that can help them adjust or integrate healthy habits into their lives, and also help to manage their conditions and help to prevent disease. And so this is really important in terms of the increased awareness and increased interest that we have in health and nutrition at the moment. There's never been a time when people are searching for advice, searching for information, and also looking for experts such as you. So this makes this time, this year in particular, a key year to integrate digital nutrition tools into your practice. So when we're looking at personalization, of course, us as nutrition professionals have always personalized, but when we are looking at kind of the next evolution of nutrition science and nutrition practice, we have to take into account the use of technology. So if we look at some of the recent studies that have come out, the first one that I'll point to there is Jeanette et al., which was published around about November or December at the end of last year, which is a systematic review. And that really highlighted the importance of providing personalized nutrition advice, which is superior than generic advice. And so this is really, really important. The second one looks at the PREDICT study. So in the PREDICT study, they found that individuals respond very differently to the same foods. And of course, they used a very systems approach using different technologies within that. But the microbiome played an important role, and as Margarida said as well, played an important role in understanding not only identifying how different foods impact the microbiome, but also looking ahead of how that could improve or impact your cardiometabolic response. And then we look at the third one there, which is also a study that was published at the end of last year by Rollo et al. This was an Australian study. And it was very interesting because this is exactly what they looked at in terms of using digital technologies and compare that against digital technologies plus a dietitian. So what they did was they looked at providing personalized nutrition advice using food frequency questionnaires and compared that against personalized nutrition advice based on this food frequency report, plus structured video consultations with the dietitian, as well as text messages. And it comes as no surprise that the dietetic intervention was a lot stronger and significant in terms of the behavior change that resulted in those individuals. So having technology is great, but technologies should be leveraged to make our work not even easier, but better as well. So the things are not always as they seem, though, because as we said, we always think that we have always been providing a personalized nutrition service or we are providing personalized advice. This is another interesting study that was published in 2018, again in Australia. But what they looked at was to understand what is the consumer's perspective and what is the dietitian's perspective about patient-centered care. And what they found was patients really thought that when they saw the dietitian that they were really patient-centered, but when it comes to whether they thought the advice that was given was individualized, this was not strong at all. Which means that although we think that we are providing a personalized advice, our patients or our clients may not share the same view. And so this is really important to not only communicate the benefits of a personalized nutrition approach, it is really, really important that we lay out exactly what we are doing, why we are doing it, and how we're going to deliver that personalization for that particular individual, not in terms of only what they want to achieve in terms of their health outcomes, but potentially also looking at their behavior outcomes by understanding the contextual environment that they are involved in. So when we are looking at where we were in 2020, we like to think of ourselves as the experts in nutrition. Yeah, we like to think that we are the only source and the fountain of knowledge. And of course, as many of us have seen, is that the world of nutrition is rather competitive. And so what we should use this, our knowledge for is looking at how can we evolve this practice? How can we not being seen as the food police, or how can we be seen as just the ones that maybe provide dietary, weight loss diets, and evolve that. Now, with the advances of technology, most people think that they are their own experts. They are the experts of their own bodies, and therefore our role and our value is slightly changing. This means that we are really becoming the curators of information, and we should become the orchestrators of information. Okay, we should be providing that information and putting it into a personalized plan that makes sense for the individual, that is doable and actionable for the individual, and is really relevant in terms of the context of their lives. And this is very important because it's estimated that by 2025, 80% of healthcare will be delivered online. So I'll repeat that again because that's really important. 80% of healthcare will be delivered online by 2025. So this is really, really, really important, that if we don't move our practice and our nutrition, the way we integrate information and use the scientific information and divulge that online, it will make our lives not only very difficult, it may mean that we become irrelevant. And 2025 is around the corner. So this is really, really key. So I've written about this topic of personalized nutrition and the potential of leveraging technologies for a while now. And this is one of the papers that I wrote. It was published at the beginning of last year, I think it was, where I really highlight we should be integrating technologies and doing this slowly, doing it at a time when how we feel comfortable, what our patients or our patient group needs, and being aware of what is out there. So using technology and moving that into the future is going to be inevitable. One of the fears is that I hear all the time is we do not want to replace, and that's why we are a little bit resistant to integrate, but this is certainly not the case. You should be able to work alongside technology and using that to enhance your practice. So just to give you a little bit of an overview of how I've integrated technologies, in around 2013, I started with a CRM system. And so this was really starting to write a newsletter, sending out emails, and really getting comfortable with the CRM system. Then by 2015, I integrated a telehealth system, which really meant that I moved everything from paper and plastic sleeves and folders and dividers completely online, so that there are no papers lying around. And even if I did go to my practice, that I logged in remotely and that everything was in one place. By 2017, I had a small team, and so it became really untenable to communicate via email. And so we started integrating Slack. So now we send very few emails and everything happens on Slack. By 2019, this was towards the end of my PhD, and now, of course, I became very familiar with statistical programs and using kind of data analysis, whether that was via Excel as well, but doing everything online. By 2020, so that was last year, I also learned how to use a platform to conduct digital studies completely online. So that meant drawing up the study protocol, the study task, providing e-consent. And so that also gave me another skill in terms of digital technologies. And then just 3 weeks ago, we launched the Kina platform, which I'll also show you in a minute. And this really highlights this move and this evolution in terms of what I see the gaps are and how I see nutrition evolution and moving forward in terms of nutrition practice. So everything is along the timeline. I say nothing happened all at the same time, but as you learn and as you see the gaps, and increase your digital skills, your digital literacy, it also means that your income can increase, such as was in my case. So which technologies should you leverage? Well, the first part there I mentioned is identify your niche and set up your funnel. So that is a completely separate webinar, which we might do at another time, but I will assume that you have an idea of who you want to target, who you want to serve, and how you capture those contacts. So I think in order for you to go online and to leverage technologies, is really to have a technology that helps you to be more efficient, yeah, because it helps you to focus. It helps you to focus your time. It helps you to plan better, and therefore you can serve faster. The second one is looking at recruitment. So how are you going to capture those contents or contacts, and how do you keep all your information nice and tidy so you can find it quickly, and also find new clients very quickly, whether that's through a network that you belong to, so you can get inbound referrals, or that you can also send referrals out. The next one is how to better connect, so technologies that help you to connect. And this means tools that help you to serve your clients better. This can be anything from apps to meal plans to home testing kits, anything that helps you to be very fast, helps you to serve your clients so that they are actually having their needs met, but also helps in terms of that personalization and building not only the relationship, but also the credibility that you have with your clients. And then finally, what you don't measure, yeah, you can't manage. And therefore, it's very important to track how you are doing. So in terms of that, you need to have something in terms of analytics. So whether that is looking at analytics to your website, who's opening your content, how is your program or your practice or your approach effective in terms of the health outcomes in the individual. These are very, very important ways for you to track how you are doing and to identify the opportunities of where to go next. Okay, so the 4 types of technology, and this is my view, is technology to help you focus, technology to help you recruit, technologies to help you connect and track. And some do all of it, but in some ways you need to combine in some ways to make you more efficient and effective. So what consumers have gotten used to is a very, very good experience. Yeah. And so you are not only competing with other nutrition experts in the field or in the industry, you are essentially competing with any other digital company out there. So when you think of how easy it is to communicate or connect on Facebook, whether it's on LinkedIn, whether it's where you're buying something on Amazon, always think about what experience have people gotten so used to now that you should try and consider integrating into your practice, because people have this expectation that things are as easy across the board because of what they have become accustomed to, having everything managed and done on their smartphone. So this is critically important. Now, when we think about the value that we are adding as nutrition professionals, I said this is slightly changed. So everybody or consumers are seeing themselves as the expert, and therefore they are looking to the experts to provide a different perspective. They want us as nutrition experts to guide them in terms of what is the most credible information, what are the tools that we should be integrating, how do I track my progress, how do I know that I'm actually responding to what you are telling me in terms of diet and lifestyle, and how do I change my behavior as a key component and key determinant of personalized nutrition. And so you always have to need to think and structure your service in terms of the value that you're adding, and think about the new value that we are adding as practice has continued. Of course, when I practiced, it was very much, well, I'll see you in 6 weeks, or I'll see you in 8 weeks, and there's no communication in between, and you come into clinic. That is not really the case any longer. Yeah. And so we need to rethink the way we serve customers, the way we serve patients, the way we serve clients, and what value are the consumers and the patients looking for to us that we should be delivering to them. So some of the tools that are available right now are tools that help to shop, tools to help us to find recipes, to create meal plans, for journals and diaries, tracking tools as well. So this can be symptom trackers, also for dietary assessment, for example, home testing kits, those that just help with adopting healthy behaviors, managing conditions, and also wearables. And so when patients and clients come up with looking for solutions, we should try to first put their needs and be consumer-centric, yeah, or patient-centric, and seeing what it is that they want to achieve, not what we think they should achieve, but that joint goal setting that I mentioned before is what do they want to achieve, and how can I help you as a guide for you to help to achieve that. So when we look at selecting the right solutions for the right clients, there are obviously some things you need to think about or that practitioners are thinking about before they start integrating solutions. Now, it's very easy to adopt one and stick with it, for the rest of your practice. But of course, as science and as technology evolves, new solutions come up on the market all the time. And so if you look at the figure on the right-hand side, a recent study also published last year did a study of over 1,000 healthcare professionals. And they found that the criteria for selecting a nutrition and diet app were the top three were the ease of use, also if they were free of charge, and if they were validated. I won't go through the rest, but that gives you kind of the top three in terms of the criteria for selecting. Now, if we look on the left-hand side, there are also some barriers and challenges in other published research that look at what has been the barriers. So one of the barriers for integrating new technologies has been the lack of awareness, so not knowing what is available in the marketplace. Secondly, it's the lack of importance. This is part of my PhD as well, as finding that not only did practitioners not think technology is important because they did not want to compete with the technology, they did not feel that it had any relevance in their practice. And then also the lack of scientific validation. This was really a long-standing challenge, I would say. But now, as we can see, these studies that are looking at a comparison between, traditional dietetic practice or nutrition practice versus kind of the old version, this science is now starting to emerge. And the importance of technology is starting to emerge. And then also we have lack of peer reviews. And so what I see all the time is that the way practitioners communicate to each other or recommend solutions to each other is going either on a Facebook group or emailing or, asking it on a forum. And that is really how solutions get recommended to each other. And so this is not the best way to find new solutions. And so we really looked at what are the kind of challenges. Now, as I ran my consultancy now for the last about 10 years, we definitely could see that while the new solutions were coming onto the marketplace, we wanted to also get nutrition professionals not only to use them, but also start getting involved in developing them, have a voice in how it gets developed and what is important to their clients. And on the other hand, we get questions all the time from practitioners that say, hey, what do you think of this company, or which company shall I integrate there? And so, okay, what is the easiest way to make sure that these two important stakeholders can not only communicate, but also that we make this the uptake of personalized nutrition solutions or digital nutrition solutions a lot easier to help those consumers and patients have the tools right available, and especially those ones that are either evidence-based or have some science behind them or are credible and recommended by practitioners. So what we've done is launch the Kina platform. That's what we call it at the moment, but it really helps you to navigate current digital tools to create those personalized programs. Not only will it save you time because you don't have to do your own research, but you also have the knowledge at your fingertips. So many times we have people walking into the clinic and saying, hey, I've seen this company in the newspaper article or magazine. Do you know about them? And what do you think about them? So we wanted to make this a little bit easier. So what we've done is take the whole personalized nutrition landscape, I would call it. And so you are able to search companies by name, by tag, by goal. You can compare companies by score that we've given each company. You can read any peer reviews or also the publications that some of these solutions have put on PubMed, for example. So this is the company description. So for every company, there's a company description that can take you immediately to the company website. You can also go immediately to the publication, as I said, and peer reviews are included at the bottom, which means that you don't have to post it on a forum. You can immediately see at a quick glance what some of the attitudes are that are unprompted recommendations that found online. So if we just take a quick patient example, we have this 35-year-old lady who's looking to adopt healthier habits and to set a good example for her children because she has many food sensitivities as well. She's interested in understanding the quality of her diet, but has no interest in calorie counting or food logging. And she's also heard about a company called Kiweno, and she wants to ask you if she should buy their product. So I want to see if I can quickly give you a live view. Let me just see. Where is my... Okay, hang on 1 second. I think I should just get out of here quickly. This is the easiest way. Okay. Can you all see that? Sarah, I'll depend on you. Sarah, can you see that?
Yes, we can see it.
That's it, thank you. So this will take you to the Kina homepage. And what you can see is all the segments of the products. So it breaks it down into the different segments. And what you can then say is, okay, well, I want to see who this Kiweno was that this patient just talked to me about. So what you can see is all the companies listed that offer metabolite testing. And there you can see Kiweno. And if you go into it, you can then see the company website. You can see if they have been validated or not. And you can also send a message if you want to know more about the company by video, audio, or text. You can also at the bottom see the product description. So they offer recipes, they offer a blood test, and they do metabolites. They also have products for allergy. Now, if you want to say, okay, well, I wanted to see, for example, a company that looks at, helps the client to shop better. So Spoon Guru is a good example in the UK that offer a solution that helps clients to shop for healthier habits, for example, not healthier products. And you can again see they have published a study which looked at the comparison of their AI algorithm against the advice of a dietitian in terms of identifying products with allergens in them. And what you can also see then is what have some of the dietitians or nutritionists said online about recommending this product to each other. Finally, if you say, okay, well, the client does not like food logging, maybe they are not interested in calories and macro breakdown, maybe an intuitive eating approach is better. And that also gives you then quickly a view of which solutions are out there that you could potentially integrate into your personalized program. Okay, if you have a company that comes up that they walk into the clinic and you don't know who that is, then you can search that in the bar as well. So you can search by technology, you can search by goal, you can search by company name, or you can also, just type in the word and see if there's anything there that may be useful for you to integrate into your practice. Okay, so I'll go back to one thing I wanted to say is what we've also done is compare. So every company has a score, which makes it easy to kind of navigate the space and for you to say, okay, well, if I'm looking for a particular company, which company is scored higher? So we're looking at a company, especially when we look at personalized nutrition, we are looking for criteria such as, is it evidence-based? Do they have like mixed skills in terms of business and nutrition? Do they offer transparency and privacy and all these different areas that are important to deliver a service? So that makes it easy for you to navigate the industry and helps you to select the best possible solutions for your clients. So I'll go back quickly to my other presentation. Okay. And we're back. So what could a personalized nutrition program look like? So what I would say is we are not in the times anymore where people come back 6 to 8 weeks. Yeah, people want to see exactly what you're going to give them, exactly how it's going to work, and exactly what they are going to get. So I would suggest a personalized program really looks like this, where they come on, you onboard them on a system like Nutrium, which would be great. They already know how they're going to communicate with you, that their data is safe, and that any plan that you have for them will be automatically visible, and it's actionable for them. So you can then immediately say, well, at week 1, we're going to integrate this app, for example, we're going to do food logging, and we're going to discuss the blood results if you've ordered maybe a blood test. And that goes on for week 2, week 3, week 4, week 5. So they know exactly week by week what you're going to do. And as Margarida said, I think it's very important now that we don't have these too big appointments, but we are now getting to a point where actually the cost per appointment might be lower because we will see them more frequently. And this is very important because we need to make those small behavior changes in order to help people to manage their health outcomes. So this is really important in terms of making it transparent, making it actionable, and integrating those digital tools to help you to build those relationships that are really, really long-term so that they can meet their health goals. So in terms of the future of nutrition, I'm just looking at the time, in terms of the future of nutrition, we really things are really changing. Okay, so we are seeing this change from your 6 weeks to optimal health group programs to now being completely personalized. Yeah, we're totally moving away from that because we know now that individuals respond completely differently to dietary and lifestyle intervention, and therefore every single client or patient will not fit into a group program. We should be looking more personalized and making sure that it's completely transparent and is relevant to their situation immediately. We're also looking at health on subscription. This is a key trend that is happening now with more tests, for example, appointments, so you can see or speak to a healthcare professional when you want, when you have that question, and when you want to have a test done, rather than waiting for your appointments or your annual review. And so we are seeing more people taking up this this lifestyle medicine approach, whereby they proactively manage their health and their lifestyle, and therefore you essentially become a practitioner who will be available on subscription. So it's a different way of thinking, but think about how you are currently offering your service and how this fits into the future trends. So it's important that we work alongside technology and not against it. And really, we are providing kind of the emotional intelligence, the actionable support, and the coaching as well, by leveraging technologies and making you more effective and personalizing that experience that consumers and patients are looking for. So with that, once you start integrating more, you will become more confident. You will have more time to attract new clients and therefore build your income as well. And this does not have to take long, but it does mean that you need to make your approach actionable and be proactive in your learning as soon as possible. So for me, a digital approach is not moving from Excel to online. It's really fundamentally changing the way that you practice by leveraging these digital tools and meeting your clients where they are at in terms of what they want to achieve. Okay, and so I have 3 take-home messages. The first one is to say the only way to scale your services and make sure that you impact more people and increase your income is by leveraging technologies. That by 2025, remember, 80% will be online. The second one is that individuals respond differently to different approaches, and therefore a personalized approach leveraged by technology is really the only way to thrive, and especially as an expert, and especially as somebody that will be sought out to guide individuals. The future of health is on subscription, so position yourself as a long-term friend and a coach and a guide who uses a data-driven approach to curate and guide your clients to the optimal diet and lifestyle choices by leveraging the best in technology. So that's all for me. If you want more information, you can visit our website at kina.tech. If you are joining, you need to join as a health professional, otherwise we'll get not the relevant information. You can also follow me on Twitter and on Instagram. And sorry, I just need to click this way. And we also have a weekly newsletter that covers all the latest research and innovations in personalized nutrition. And I look forward to hearing your questions. Thank you very much.
Thank you so much, Mariette. That was so fantastic. So we actually had a few questions come in during your presentation. The first one is someone wants to know if the Kina is an app or website for nutrition professionals or if it's for the general public only.
No, it's actually not for the general public. It's actually for practitioners. At the moment, it's a business-to-business platform. So we are not advertising to consumers at all. The goal at the moment is for businesses and for practitioners to use.
Okay, awesome. And then with that said, someone else was wondering if you can use the Kina platform worldwide. So if you're based in one country and the platform only shows that country option.
Yeah, so with the search bar, so if you say you only want to see the companies in Germany, you only type in Germany in the search bar and that will come up, but the products in the database are global. So we've got companies in there from Australia, India, South Africa, they are all over. Anybody, not everybody, because we want to keep it really, core, and we don't want just everybody in there, but companies that are offering a personalized approach are in there.
Okay, great. And is the Kina platform free?
No, it's not. It will be a subscription-based platform.
Okay, awesome. That is great to know. Someone else asked, how was the transition from science to business and actually trying to do both, like how you're doing now?
Yeah, I mean, of course, I had a little bit of a heads up because I did my business degree while I was in clinical nutrition. And so I used what I learned in my MBA to apply while I was then managing the dietetics department. So by the time I got into industry, it was not such a big transition. But of course, the other skills that I learned while in industry, and I have to say, I can name them, is one, presentation skills, because you had to present all the time. B, networking is something that I did not do at all when I was in the hospital, and that became the most important skill. And then leadership, you have to be able to communicate at all levels, and I think that's definitely something that made the transition not that difficult, but it definitely is. I'm always learning, so I guess it's a good transition. For me, it was a good transition.
Awesome. Someone else wants to know how you balance your own work-life balance with the need to be available when the client wants you.
Well, I think your relationship with the client is how you set it. So if you start answering emails on the weekend, you are already setting, the tone for what your relationship is going to be. So I never answer by email. If they want to speak to me, I have two days in the week when I answer, when they can have a phone call or something. So I think it's very important that you set the culture, your company culture, the way you want it to be, and clients will respect that. And if you are realistic, then they will fit in with you so that it's a mutually beneficial relationship, because if they're going to contact me all day, they're not going to get the best out of me. And so I think if you make it clear, you should never be at the beck and call of a client, but it's a mutual agreement of how you set that. And so I have 2 kids as well. I work from home. And so for me, it's important not to be digitally switched on over the weekend. Okay, today is an exception, but yeah, I don't work on the weekends. I tend to stop at about 5 o'clock. I tend to go for my walk, do my exercise, and so I think the nice thing about the entrepreneurial life is that you can have your program the way that you want it.
Absolutely. And that is such fantastic advice, I think, really for anyone who is working remotely. But I think specifically like within the nutrition field, and like you said, setting those boundaries is just so important. Someone else was wondering what you think is the best way to present technology to a nutrition professional who has had used the same process with paper and calculator for over 10 years.
Yeah, that is a challenge. And I think the first thing is always to understand why, what is it in the paper and pen that you are attached to? Is it the fear of the unknown, or is it the fear of the failure? Because sometimes people don't want to start something because it takes too long to learn. They're going to fail because, some people are, oh, I don't do tech, or, I'm too old to learn tech. And that's certainly not the case. My dad sent me an attachment on WhatsApp the other day. So it's kind of like, you can learn, but there is a prioritization factor to that. So if you don't put aside 1 hour a day to say, okay, this is my learning hour, and I'm going to just spend this time just to learn one thing. Yeah, I'm just going to learn how to switch it on, and I'm going to learn one function on this platform. That's the way to start. People too often think that they need to be whizzes at everything and be perfect at everything, and that's certainly not the case. Small steps. Learn one thing, practice, and then it becomes second nature. Then you do the next function. It's small steps, but that's the way. So first find out what the resistance is, and what are you currently doing on paper. Let me show you one thing that you can do that exact same thing online.
Absolutely. Yeah, that's great advice. Someone else wants to know if you think your MBA was crucial to change your mindset as a nutrition professional to an entrepreneur, because they feel like healthcare professionals don't have access during their education process to this kind of skill set.
Yeah, this is it's a question that I get all the time. And whenever somebody asks me, should you do an MBA, I always say, damn right, do it, because I do think it helps you to think slightly in a different way. And it helps you to see opportunities that you wouldn't have maybe otherwise have seen. Having said that, it's more about the attitude, your learning attitude rather than anything else. And I think there are shorter courses out there. You don't have to fork out, thousands to get like the MBA kind of skills. You can do it one at a time as well, like module at a time. And I've actually developed, because of this gap, I've developed an entrepreneurial, it's called Business Innovation, Creativity and Entrepreneurship for Nutrition Professionals, which is offered at university level. And this really teaches dietitians and nutritionists not only to be able to have that entrepreneurial mindset, it also helps you to think about, well, you can also create a Kina platform. Yeah, you can also do it. It's not impossible, but it helps you just with that step. So I do think the MBA has been very important in my development and the way that I see the world and the way that I approach projects, but it's certainly not impossible.
Awesome. Okay, that's fantastic. Yeah, so we do have like one more question, if that's okay for you. Do you have time for one more question?
Yeah, that's fine.
Okay. Other people want to know if the Kina platform is one of a kind, or if there are other similar tech platforms out there.
Yeah, that's a very good question. So we are first, I'm glad to announce, because basically the other platforms out there are mainly aimed at investors. So you can have the database of solutions, for example, and then you can search by how much they got invested, or who the investors are and what funding round they got. There is another platform as well that has kind of apps and digital platforms available, but you can't search it by specific technology or function, and the focus is more on diseases rather than prevention and nutrition specifically. So I would say, yes, we are one of a kind.
So then do you use any other nutrition apps with your clients?
Well, at the moment, my business is solely B2B now. So it's completely with other businesses. So at the moment, I don't see private clients anymore. So and even with that, we use Slack,
okay.
or other ways of communication for the businesses.
Okay. And then someone else just asked what your PhD is on.
Yeah, so my PhD was on looking at the determinants of the uptake of personalized nutrition technologies amongst dietitians. And one of the key findings, of course, was that it wasn't so much about the technology, it was very much about the entrepreneurial mindset of the dietitians. And so many dietitians who thought that, yes, the science is not there, but this is where the future is heading. We need to integrate now and learn now because, you know, when it becomes mainstream, we are already there. So that was the mindset that was really one of the key learnings from the PhD. It's not just about the knowledge, because we love knowledge. It's also about the entrepreneurial mindset to help you to integrate.
Absolutely. And one more person asked what the most important soft skills are to have for telehealth.
Yeah, I think you need to be a very, very good listener, because when you have when you don't have the face-to-face clinic setting, it can be slightly more it can be different. But I also think that in terms of communication, you need to be able because it's very easy to get distracted and, you know, the dog's running around. So you need to be able to still be tuned into those cues. So the soft skills are definitely very good listening skills, very good communication skills, and making sure that you speak slower, you know, you are clear, that you check all the time that your patient is understanding what you're doing and that they understand what the next steps are within your plan.
Okay. Yeah, definitely understand that. And someone just had a quick question about repeating about the course on innovation for nutrition professionals, just kind of mentioning that one more time.
Oh, that is kind of at the moment only offered at a university in London. So it's not available for free unless other universities want to deliver it online. But at the moment, it's only delivered in London.
Okay. Awesome. Well, that's fantastic. I'm not really seeing any other questions come through. It looks like you answered them at a very timely response. So thank you for that. Yeah, if anyone else has any other questions, please feel free to just send your questions with the comment box, and then we will get back to you later on within the webinar as we do our debate later on. So thank you again so much, Mariette, for your time. We really appreciate it, and it was great to hear from you and just learn more about what you do and what your company is about.
Thank you.
All right, so guys, with that said, we are going to be taking our very first break. This is going to last for 15 minutes, and then we are going to resume with our next speaker, Harriet Smith. She will be talking about how to improve your marketing and communication skills, so you definitely don't want to miss out on this. We are also going to be talking about how to work remotely as a nutrition professional. And so we will go ahead and see you guys in 15 minutes back here to discuss more with our webinar. Hi, everyone, and welcome back from your break. I hope you guys had a good time getting rested and rejuvenated, and you're ready to hit the second portion of our webinar. So before we get started, I actually wanted to go back over the giveaway information with you one more time in case you missed it. So let's just run over the prizes really fast. So we have 3 prizes that are available: the AirPods and the Nutrium license. The second prize is the telehealth toolkit and the Nutrium license. And the third prize is the Amazon voucher worth €100 and Nutrium's license. These licenses that we are offering are annual, and they are both for the follow-up package as well for unlimited patients. So don't forget to check out our website for further details. I'm going to quickly run over the how to join giveaway steps really fast again. So you can do this by completing the registration process with the same email you use to sign up for the webinar registration. And then you can donate to Helpo. And we already have provided the IBAN and SWIFT number for you guys, and we can pop that back up on the screen or share it with you later. And then once you are done donating to Helpo, just go ahead and send a confirmation of your donation to partnerships@nutrium.io. And that's it. That's how you get entered in for the giveaway. Please pay attention to Nutrium social media accounts next week, because we will be sharing the winners over there. So, again, we can pop up the social media so you guys can go follow and make sure that you are paying attention to when the winners are announced. And before we actually hop right into the next portion of our webinar, we just wanted to thank you guys so much for those of you who have sent in questions and who have been participating so far. It is great to see your questions, but we want to continue hearing from you. So please leave them in the question box here so that way we know to answer them. And then also please let us know what you want the speakers to talk about on their debate, because after our next speakers, Harriet and Maeve, we're going to be doing a debate between all 4 speakers, and we're going to have a few different topics. So if you have anything that you are really wanting them to talk about, please let us know so we can make sure to include as many as we possibly can. So we are actually waiting on Harriet to join us, so it might be a few more minutes. So go ahead and sit tight until Harriet joins. But again, just go ahead and enter in those questions so that way we know what you guys are interested in. And yeah, thank you guys so much for sticking around, and we look forward to just continuing on with the webinar, starting off with Harriet. Okay, so we are ready to continue on our webinar with the next speaker, Harriet Smith. So Harriet is an industry-leading nutrition and health writer and has over 6 years of experience writing for consumers, industry, and national media. In December 2019, Harriet founded HRS Communications, a successful and fast-growing nutrition communications agency that produces evidence-based content, delivers impactful strategies, ensures industry compliance, and conducts outreach work for food, nutrition, and medical nutrition brands globally. Today, she's going to be talking with us about how to enhance your communication and marketing skills. So Harriet, go ahead and take it away.
Hi, Sarah. Thank you very much for your introduction. Can I just check, should I share my screen? I think someone's sharing it for me. Brilliant.
Yes, we already have it, so you're good.
Perfect, thank you. Hello, everybody, and thanks for joining me today for my talk on enhancing your communication and marketing skills as a nutrition professional. My name's Harriet, and I'm a UK registered dietitian, a health writer, and a founder of HRS Communications. My journey as a dietitian began at King's College in London, where I undertook my BSc in Nutrition and Dietetics. During my time studying as a dietitian, I realised that my key areas of interest and skills were very much in health writing and communications. And I went on to work in several PR and marketing agencies working on health and nutrition accounts in London. Alongside that, I worked in private practice as a dietitian, and I also built up my health writing and freelance marketing and PR work. In 2019, I rebranded my company as a nutrition communications agency. And as Sarah mentioned, it's led by registered dietitians, nutritionists. We have marketeers, strategists, and health writers also on our team. HRS Communications focuses on producing evidence-based content, strategy. We help companies to ensure industry compliance, and we also conduct outreach and brand awareness work on behalf of food, nutrition, and medical nutrition brands. I'm registered with the British Dietetic Association, and I also was lucky enough to have been awarded the Complete Nutrition Magazine Writer of the Year Award in 2018. So I feel very privileged to have been able to form a business which combines my dietetic background also with my writing and communications interests. Next slide, please. So during today's talk, I'm going to talk to you about marketing and communications in terms of your own nutrition business. I'm sure many of you joining us here today will run your own freelance practice, whether that's working with patients or companies. We're going to talk about how best to understand your ideal target audience. Once we talk through that, we're going to think about how best to communicate with them to meet their needs. We're also going to talk about the importance of building your client base, as well as building a supportive network around you as you go about building your brand. We're going to talk about personal PR and championing your brand, so your own marketing for your business, as well as building a simple nutrition communication strategy to help with that. And finally, we're going to talk about streamlining processes and the importance of consistency throughout your marketing. Next slide, please. Thank you. So first of all, what is a target audience? Well, a target audience is a group of consumers that a business will direct their marketing towards in order to drive brand awareness of your products and services. So when you think about your target audience, who are they? Now, the answer is it's probably not going to be everybody interested in food, nutrition, and health. And it is important to have a clear idea of what your strengths and your areas of expertise are when it comes to building your brand. A useful way of helping to define your target audience is conducting a client mapping avatar activity. And in a moment, I'm going to show you the next slide, which shows you how to go about doing that using a template. But a mapping avatar activity helps you to paint a holistic picture of what your ideal target audience looks like. It helps to bring to life your ideal client, and it really helps you to get into the shoes of who they are and why they need your services. And the avatar activity looks at things such as their demographics, their challenges and pain points, their goals, values, and also where they get their information from. So if we move on to the next slide, This is a very simple template that I've prepared for you, which helps you to think more about your target audience. Now, I recognise that some people on this webinar will perhaps work in private practice with patients, in which case you might like to use this activity to think about who your target patients are. Other people, such as myself, may work with businesses and brands, which means you might operate a business-to-business business model. So when you're doing the client avatar activity, you might be thinking in terms of an individual within a company that you'd like to work with. For the purposes of this webinar, I'm going to use an example of a dietitian or a nutritionist who works in clinical practice and perhaps offers weight management consultations as one of their services. So as I talk, the different boxes should begin to populate. So first of all, let's say, for example, I'm targeting my weight loss consultations towards people in their 20s to 30s. I might be focusing on males predominantly, and you may have a specific location in mind that you want to target. For example, it may be that your clinic is located in a certain area. Next, we want to think about a quote that's pertinent to your target audience. In this example, this gentleman that I'm thinking of as my ideal target might be thinking, I just can't seem to shift any weight. I've tried loads of diets. I don't know where I'm going wrong. And that's really important when I think about addressing my products and services to meet his needs. Also important to think about the sorts of jobs that your target audience have. So it may be, for example, that my target audience lives a fairly sedentary job, so a call centre manager as an example. It's also important to think about their level of education. In this example, my target audience might be a school leaver with GCSE qualifications, for example. So generally, your target audience will have similar levels of nutrition knowledge, education, shared goals, values, interests, and problems. So it's important to also think about their goals and values. So in this example, this gentleman's goals might be to lose weight and to learn how to cook healthy meals at home. And his values are very much family orientated. He wants to set a good example to his family. And also quality of life focused. So for example, he may have family history of specific diseases that he wants to address and reduce his own risk through diet and lifestyle. Next up, we want to think about where our target audience get their information from. That could be newspapers, magazines, word of mouth, colleagues, friends, television. And it's important to make sure that the communication channels that you're using are most appropriate for your target audience and that you're talking to them in the right tone of voice, the right language for their needs. Next up, we want to think about the greatest difficulties and challenges that your ideal clients are facing. In this example, it may be that this gentleman has limited nutrition knowledge, a low income, and perhaps he lacks confidence in going about making these changes. Pain points might include not knowing which diet to follow, doesn't know how to start, and thinking that a healthy lifestyle is just too expensive. It's also important when you map out your client avatar to think about where else they could go other than your business to solve the problems and challenges that they have. So these are essentially objections to the sale. Why would they look elsewhere? In this example, the gentleman could perhaps go onto social media and get free diet and nutrition information from social media influencers. He could also go and try one of these highly marketed fad diets that promises him quick weight loss solutions. And finally, it's important to think about your target audience and the role that they play in purchasing from your business. In this example, the gentleman is perhaps the direct customer, the direct consumer. But if your business works with other businesses, so it's business to business, it may be that the person that you are trying to sell your services to is head of marketing, for example, and they may have to then go and report back to other divisions within their company in order to make a purchase from your business. So this is a really useful template that hopefully you can go away after this webinar and populate in your own time to really help you to define who your target audience is. And that will then help with your marketing and the value propositions for your own brand. Next slide, please. Thank you. So market research is another key piece of advice that I would have for any nutrition professional, whether you're working with patients or with other companies. Market research helps you to have a clear understanding of your clients' needs and how best they'd like for you to communicate with them. It helps you to deepen your relationship through learning exactly what they want from you, your business, and your content. There are different ways to go about doing market research. For example, you can conduct polls on platforms such as Twitter and Instagram, and this provides a really quick snapshot survey of people's thoughts, and it often requires an immediate yes or no answer. Surveys can provide a more detailed response from your market research in instances when you perhaps need more than just a yes or no answer, and there are plenty of free survey platforms available, such as SurveyMonkey, where you can go about doing surveys with your target audience. It can be as simple as sending out a feedback form. So for example, it may be that after you've worked with a patient or you've worked with a company, you embed into a process within your company a feedback form going out to previous clients. And that can be helpful for continual evaluation of your practice and evaluating the overall client or user experience. Another form of market research is conducting telephone or email interviews. And again, this is a more in-depth way of getting into the shoes of your clients, and you can quiz them about processes, new products or services that you're thinking of launching, and therefore use the findings to help introduce new concepts in your business. Just a note on the market research, it can also include doing desk or field research. So going and doing some online searching, looking at what's relevant and topical at the moment and what there is a need for. And a perfect example of that would be coronavirus. We're living in a digital era. Lots of people are putting a bigger focus on improving their health and lifestyle. So that is a rationale for offering nutrition and dietetic support, for example. So you can do a lot of market research by sitting down at your desk and doing some research, but also looking at what competitors are doing. So nutrition does tend to be quite a friendly, close-knit community, but it is important to look at what other people who run similar businesses to yourself are doing. Can you chat to them? Can you go onto their websites, follow their social media? Not only will it help with your own idea generation, but it can also be useful to know the competition that you're facing in the industry. So now we're going to talk about the best ways to market and communicate with your ideal target audience. Hopefully many of you here today as nutrition professionals are familiar with especially these more traditional forms of marketing. So having a website is often fundamental for a freelance nutrition professional. And it may seem obvious, it's a hub of information about yourself, the services, the products you offer, and how to contact you. But I would reiterate that first impressions really do count. And I've spent a lot of time as been part of my role at HRS, and also when I worked in private practice, looking at competitor websites, looking at other food nutrition businesses. And you do notice when, for example, information is outdated, picture quality is not high, and that really does rub off on the overall impression that you get for someone's business, and it affects credibility and professionalism as well. So it's really worth having a simple, clear, clean looking website, thinking about the impressions that it's giving off and making sure that the information and content is up to date and relevant. Having a presence on social media is incredibly important, and I know many of the speakers on the webinar today have chatted to you about this. It's important to remember that although content is king, engagement is queen. So you want the content to be useful to your target audience. And one way of monitoring that is just by looking at how good the response is that you get from your target audience. Are they liking, sharing, engaging with your content? Remember that less can be more. So it may be from your market research that you identify that 2 or 3 social media platforms are most important for your marketing, rather than focusing on all 4 or 5 platforms. Newsletters can be a great way to help your business to stay at the forefront of past, present, and future clients' minds. And they can offer a great opportunity for sharing information on products, services, but also testimonials and feedback, which we're going to talk about later on in this presentation. More innovative forms of communication, especially in this digital era that we find ourselves in at the moment, include things such as podcasts. Podcasts offer an ideal opportunity to explore certain topics and collaborate with other key opinion leaders in an engaging format that your target audience can listen to when they're out and about and on the go. Apps provide a really useful, remote and accessible resource that you can share information between yourself and your clients. I know that Nutrium, for example, offer a great app that you can download and your patients can download to track their progress. Videography and webinars are particularly relevant at the moment, and they're a really great visual way of putting content out there to your target audience. So these are perhaps some more innovative ideas to think about. It might not be that you're going to go off and do all of these ideas, but again, use that market research to find out how your target audience want you to communicate with them, and perhaps set 2 or 3 realistic goals over the next year. So it might be focusing on updating your website, for example, having a couple of social media posts going out each week, and focusing on having a podcast episode launched. So just start small and then build up gradually. We're now going to talk about how to expand your client base as a nutrition professional. We mustn't underestimate the power of personal PR. PR stands for public relations. This is all about increasing your exposure as a brand and essentially shouting about what you do and what you offer. People sometimes believe that you need to have a big budget in order to do your own PR for your business. And that's not necessarily true. There's a lot of free PR opportunities out there if you go and seek them. For example, make use of local businesses, organizations, and charities that are relevant to your business and your target audience. For example, when I worked as a private practice dietitian, I reached out to local health clubs and offered to give free talks about nutrition and health. And indirectly, that led to bookings through my clinic. Similarly, as a health writer, I'm often on the lookout for #journo requests on platforms like Twitter. This is a great way of connecting with journalists who work for newspapers who need to connect with experts in the nutrition or health field. And they can come to you for an expert quote. Yes, you may not get paid for the opportunity, and that's very common in journalism. However, it often leads to increased brand exposure and sometimes paid work. To give you an example of the power of journo requests, about 6 months ago during the coronavirus pandemic, I connected with a journalist from Sky News, which is a major publication in the UK, and they were looking for a dietitian to provide a quote on vitamin C and immunity. I gave them the quote, the article was published, and within a couple of hours of the article coming out, I received an email from a managing director of a big charitable organisation wanting to commission my business to write a series of articles for their website, which was, of course, paid work. And so that unpaid PR opportunity resulted in direct paid work. So it really does pay off. Customer Relationship Manager, you may have heard of this as a CRM system, is a really important system to embed within your business. You can go online and subscribe to paid platforms which help you to manage past, present, and future clients and their data. But it doesn't have to be as simple as that. It can be as simple as having your own spreadsheet where you list the details of past, present, and future clients, their names, contact details, etc. Do remember to make sure that if you are collecting people's personal data, you need to make sure that you're doing that within your country's data protection laws. However, if they have opted in to receive marketing communications from your business, then using your CRM is a great way of bringing your brand to the forefront of their minds and making them aware of the services and products that you offer. You can help to build your CRM system by offering your target audience free content or downloads, whether that's on social media or on your website, and you can ask them to input their data in order to access the download, which can therefore help you to build your database on your CRM system. Next up, I want to talk to you about the importance of building a network around your business. And I'm talking about building a network, not just in terms of your target audience, so customers or businesses that you want to work with, but also fellow freelance professionals who can form a support network for you as a business owner. So how do we go about networking? Well, in an ideal world, if coronavirus didn't exist, we would probably be going face-to-face to groups, conferences, etc. But even in this digital era, there's still a huge amount of networking opportunities available to us as nutrition professionals. Social media platforms offer a great way of networking, and LinkedIn is a perfect example of this. LinkedIn is typically a business-to-business networking platform. I use LinkedIn not only to connect with fellow nutrition professionals, to engage and share the work that I'm up to, but I also am always on the lookout for companies that I want to work with on LinkedIn. And the way that I go about doing this is I'd identify someone within that business on LinkedIn. Perhaps I have a mutual connection with them or a shared interest, and I might message them on LinkedIn, and depending on their interest, that may evolve to a telephone or a Zoom consultation to make them aware of my business and to learn more about their business. And sometimes that might even lead to paid work in the future. So LinkedIn, for example, is a really good way of building your professional network. Professional membership groups and forums are another great way of going about networking. In the UK, for example, we have our professional dietetic trade association called the British Dietetic Association, which I'm a member of. Being a member of the BDA gives you a range of benefits such as networking opportunities, CPD opportunities, and also a trade union support system. But there are also lots of professional membership groups and forums that you can join online. For example, again, in the UK, we have the Freelance Dietitian Facebook group, and there are several Facebook groups for freelance nutrition professionals, such as NutriTribe and Nutrimote. Many of you will be familiar with Nutrimote, which Maeve, one of the speakers today, has founded, and it's a great hub for online nutrition professionals to network and support one another within. So I'd encourage you to have a look in your countries and to see if there are professional membership or forums that you can join as a dietitian or nutritionist. Thirdly, the importance of collaborations shouldn't be underestimated. Collaborations help you to sow the seeds for aspirational partnerships and collaborations, whether that's with your target audience of businesses or patients. Again, be proactive. A lot of the opportunities don't directly come to you. You have to go out and seek these opportunities. So that could be through LinkedIn, like I mentioned, reaching out to companies. It could be picking up the phone or dropping an email to a company or a charity or a newspaper that you'd like to work with and offering up your services and building that collaborative opportunity for your business. Championing your brand. This is, again, part of your personal PR. This is about shouting about the great work that your business does. Sharing feedback, outcomes, and testimonials can be incredibly powerful. And I've shared an example from my HRS Communications website. We have an Our Work tab on the website, which showcases articles that we've written, content that we've produced, as well as testimonies and feedback from our clients. So if you work with patients, for example, can you perhaps ask them to share some feedback or a quote that you can share on your website or on social media? Of course, again, with their consent and in line with data protection rules. If you work with patients, can you collect outcome data to show that you're making meaningful changes for your patients? Secondly, do display your portfolio of work, whether that's on social media, LinkedIn platforms, or on your website. It's really important when you're pitching to new businesses and trying to look for new opportunities that you have a portfolio of work that you can showcase your talents, skills, and services. So like I mentioned, it might be having links to articles that you've written. If you've been quoted in the media, it would be great to have links to that on your website and on your social media platforms. So next up, I'm going to talk to you about the importance of having a strategy in place for your communications within your own nutrition business. Now, strategy development is a key service that we offer at HRS Communications to our food, nutrition, and medical nutrition clients. But it doesn't matter if you work with patients or you work with businesses. Either way, it's important to have a communication strategy in place for your own business. And when you think of a strategy, you might be thinking of huge, great spreadsheets and loads of information inputted into it. It doesn't have to be complicated. It can be as simple as having a one side of A4, a plan for each month. The way that we go about putting our strategies together for our clients and for our own business is to begin by looking at each month and thinking about key products or services that we offer or our clients offer that we wish to promote each month. Next up, we look at aligning those products and services with key and relevant calendar dates. And then finally, the final step is looking at our content creation and making sure that any deliverables that we're creating, whether that's blog posts, articles, videos, podcasts, are aligned with the key calendar dates and the key products or services that we're wishing to promote each month. To give you an example, January, for example, is typically a time when people make New Year's resolutions. They resolve to be healthier, to make changes to their diet and lifestyle. If I was a weight loss dietitian, it may be that January is an ideal time for me to promote my weight loss packages that I offer to patients. The key date that would tie in with would of course be January and New Year's resolutions. And I would then want to make sure that any content I'm pushing out across my business in January is relevant to New Year's resolutions and my weight loss services. So it might be that I think about writing a blog on why fad diets don't work, or creating a video on how to help your patients to make sustainable dietary changes. Therefore, the content that I'm creating is not only relevant, but it's also linked in with the product or service that I'm wishing to market. So I just wanted to have a conversation about the importance of consistency when we talk about our communications and marketing as nutrition professionals. Firstly, consistency in terms of your branding. So professionalism and branding, I think, needs to be uniform across all visual assets. So whether that's your logo, the colours that you're using on your website, social media, the types of fonts that you're using, but also the tone of voice that you're using. And when we talked about the customer avatar activity, we talked about talking to our target audience in the right way that they like to receive information. So for example, if your target audience is families, it may be that you're targeting mums and dads. So the tone of voice that you're using on your website and social media might be quite engaging and informative and friendly. If, for example, your target audience are marketing businesses or scientific companies, it may be that the tone of voice that you're using on your website and other marketing platforms are more business focused than perhaps when you're talking to a patient. So it's really important to identify what the best tone of voice is for your marketing and make sure it's consistent across all communications channels. Processes require consistency as well. So can you streamline the process, for example, of when a new potential patient gets in touch with your business? Do you have, for example, an email template ready to go out when you have an inquiry come through? Do you have a booking email drafted that goes out when a client makes a booking? Can you, for example, have a template prepared after you've had a consultation with a patient that you can amend based on the patient information when writing a referral letter to a healthcare professional? Similarly, if you send out consultation summary notes to your patients, can you have a template saved that you can just amend each time you see a different patient? This can really help to streamline the process, making it more quick and more efficient for everybody involved. Finally, consistency in terms of timings with your client communications is very important because you want your target audience to know when they can expect to hear from your brand. So whether you're producing blog posts, social media, or newsletters as part of your marketing, think about how frequently you're going to offer them. Are you going to do them daily, weekly, monthly, or even quarterly? It doesn't matter so much how frequently you're doing them, but the important message is consistency. Be consistent with how frequently you're sending this content out. So my main takeaway points from today's talk are really get into the grips of who your target audience is. Identify your target audience, whether that's through conducting the customer avatar activity that we talked about, or whether that's from doing field or desk market research. Learn what their challenges, their pain points are, and help to answer those, solve those problems through the content that you're producing, the services and products that you're offering. Your market research will also help you to identify how best to communicate with your clients, including when, how, and where they're most likely to engage with your business. Build a nutrition communication strategy around key dates, key products or services that you want to promote each month, and make sure that the content you're pushing out is in line with those dates and services that you're wishing to promote. Don't underestimate the power of personal PR. Make the most of free opportunities available to you, whether that's hashtag journal requests, or whether that's being proactive and reaching out to local newspapers, charities, or organisations that you'd like to work with. And finally, be consistent with your communications, whether that's your branding, the processes that you've embedded within your business, and the timings and frequency of your communications. Consistency is key. So thank you very much for listening. I hope you found this a useful webinar. You can find more information about me and my business via our website. You can also drop me an email, and we're also on social media. So I'd like to thank you for your time, and also to Nutrium for this opportunity.
Well, thank you so much, Harriet. It was great to hear from you and learn more about what you do as a nutritionist and a dietitian, specifically within the online space. So can we actually go back to the client avatar slide? So that way people can just kind of take some notes and just kind of make sure that they have it all together. And we do have a few questions for you. So one of the questions is, does HRS offer market research services for a new startup where funding is challenging?
We do work with a lot of our clients to support with their market research. Many of the companies that we work with, their target audience is actually healthcare professionals. And we will help them, whether that's through desk or field research. Many of our clients ask us to go away and speak to their target audience, for example, dietitians. We do that in a variety of ways. It might be conducting telephone interviews, for example. It might be running roundtables and focus groups. It can also be as simple as conducting surveys and polls. And then the next step, which is really pertinent to the business and their communication strategy, is analysing that market research, looking at what it means, what does the client want, and adapting their communication and content strategy accordingly. So we work with companies ranging from startups right up to your big blue chip companies, and they all have differing budgets. And I think that's a key message when you do work with companies. Always find out what their expectations are from you, what their budget is. There's always ways to help people, but it may be that you have to scale back what you're offering depending on their budget.
Right, absolutely. Someone else has a question on how to get a weekly radio slot.
That's a great idea. I can't say it's something that I've actually gone about doing myself, but I would suggest if radio is what you're interested in, I would look at radio stations within your country. Start small, so perhaps look within your local region. Do you have a local radio station? Then do a bit of research into the radio station. Have a look on their website, listen to the radio station, of course, and find out if they have anything that's relevant or linked to your company and the services that you offer. For example, it might be that your radio station has a weekly slot where they talk about nutrition and health, or they might have a weekly slot where they talk about food. So make sure when you then go to communicate and reach out to the radio station, you've shown and demonstrated that you've done some research into their company and the shows that they offer, and try and then link that in with your business. For example, I've seen that you offer a food program. Did you know I'm a dietitian? One of the services that I offer is XYZ. I was wondering if you'd be interested in, and then you could give them a few ideas. And I would say always follow up on the phone. So even when you sent an email, lots of journalists, radio stations, TV stations are incredibly busy. They will not often reply to your email. So pick up the phone if you can. If you know someone that works within the radio station, go via them. Message them on social media. Don't give up. There are always ways to get involved, but do be persistent.
Mm-hmm. Absolutely. Well, those are all fantastic answers. And, it's really great to hear, your advice and your thoughts just on growing social media and really how to be active and present in the online space, because like you're saying, everything is just really starting to transition to be online. And the more we are online and able to really focus on the clients and making sure that we are providing the things that are able to help them the most, that's really great. So thank you again so much for all of your feedback and your, great presentation. If we have any other questions, we will definitely direct them towards you during our debate section. But I'm not really seeing any other questions pop up right now. So we will definitely be talking to you a little bit later on during our debates. But thank you again so much for, talking to us about all of this. And it was a great thing. So thank you again so much for that.
Thank you.
Okay, great. So now we are going to be moving on to our fourth and final speaker, Maeve Hanan. Maeve is a nutrition professional who has a range of experience in clinical nutrition and nutrition communications. She is the director of Dietetically Speaking, which promotes evidence-based nutrition messages online and on social media. She is passionate about communicating evidence-based nutrition messages, which promote overall health, including a healthy relationship with food. Today, she's going to be talking to us about working as a remote nutrition professional. So go ahead and take it away.
Just realized I was muted there. Thank you for that lovely introduction. And I'm delighted to be here to talk to you today about working as a remote nutrition professional. It's a topic that I'm really interested in, I'm really passionate about. So it's great to be able to speak with you today. So for those of you who don't know me, I'll give you a little bit more information about my background. So I'm a registered dietitian, and I'm registered in both the Republic of Ireland, where I'm from, and also in the United Kingdom, where I currently live. In terms of my career journey, I studied in Northern Ireland in the UK, and my first role as a dietitian was in the NHS, and I worked there. So that's the National Health Service in the UK. So it was working in the hospital and in the community. I was there for about 5 years, and I worked in a variety of settings. So I worked as a general dietitian, I worked as a stroke specialist dietitian, and also as a pediatric specialist dietitian. And then it was in 2018 that I became a freelance dietitian, and I also became a remote dietitian at that time. I was going traveling, and my partner works fully online. And I just saw this opportunity to see if I could make this work in terms of being a remote nutrition professional. I'd heard of a few people that had done it at that time, but it was quite new. Obviously, things have changed a lot over the past year, in particular with the coronavirus pandemic. But at that time, it felt a lot newer. And I started Dietetically Speaking back in 2015. And that's really about promoting evidence-based nutrition and a healthy relationship with food online and on social media. It started out really as a hobby, as a blog, for my own learning, my own interest, and it's become basically a freelance business. And Nutrimote, I started that with my partner, Anthony. That was more recent. That was around April last year. And that is a hub for remote nutrition professionals. So university qualified dietitians and nutritionists or students on either of those courses. We have our website, we have our Facebook group, and our newsletter. So moving on to my next slide. This talk is going to cover these 3 areas. So focusing on remote work options for nutrition professionals, that's really one of the main questions I get asked when somebody is interested in exploring this area of working as a remote nutrition professional. Also then some of the technical side of things in terms of nutrition software solutions to enhance remote working. So I'll be referring back to some of the previous talks, particularly Mariette's content around nutrition software, because she covered that really well. And then lastly, I'll be talking about the role of social media for remote nutrition professionals. So social media was really where my own remote nutrition journey started. So I thought it might be useful to give some tips and insight related to that. And just to mention as well that I am an affiliate for Canva and Nutrium as a disclosure. So on this slide here, we're going to start off by looking at the different remote working options for nutrition professionals. As I said, this is a very understandably common question that somebody might have if they're thinking about becoming a remote nutrition professional. So being able to work online, again, before the pandemic, it might be so that you can have flexibility in terms of traveling, or it could be about, working from home, or it could be just the type of work itself may be of interest. So there's lots of different reasons why somebody might be drawn to work remotely. And it also doesn't need to be all or nothing. So many people, have some in-person work and then some remote work, whereas some people obviously prefer one route or the other. So the different areas I've listed here, it's not an exhaustive list, but it's some of the main areas to think about if you're looking for remote nutrition work. And in my experience as well, these are the most common areas where there are these opportunities. So I put telehealth there first on the list because I think it's the one that a lot of nutrition professionals will be more familiar with. And I found, again, in my experience, that it can be quite a reliable income stream. And it's one as well that obviously if we were having this webinar, last year before the pandemic really took hold, then the conversation might be quite different. We might be talking about this really up and coming area of telehealth, whereas over the past year, many people have had to expand into this area. All of a sudden, they've just had to adapt because of lockdown and everything that's happened. So I think a lot more nutrition professionals are becoming comfortable with this area, or at least exploring this area of telehealth. So what telehealth means is working with our clients either via the telephone, so that's where the name comes from, because that was how it originated, or more commonly now, it's really via video consultation. And I've put online coaching there as well, because again, that's a newer area and a newer way of interacting with our clients. Mariette touched on it earlier about how we can give that extra level of support, and it's also what clients are expecting more often, in terms of life coaches and fitness coaches. People are looking for that nutrition coaching. So it's that extra input in between sessions. So it's not just, every few weeks you have a video consultation. It's being able to interact with your clients in between that. So they're getting more support and more guidance, and it's more individualized care as well. So the next one really to think about is consultancy or project-based work. So this can really vary, and it overlaps with a lot of the other points that I've listed. So when I started out working remotely, it was on the side when I was working full-time as a dietitian in the National Health Service in the UK. So I was doing some nutrition writing, I was doing some project work while I was still working in the hospital. And it was similar when I started to travel. It was mainly nutrition writing and consultancy that I was doing, some telehealth as well. But it is a really nice flexible option. In terms of some of the different types of projects, it's going to really depend on the company and what they want support with. So it might be nutrition writing, it might be recipe analysis, it could be developing menus, it could be input in terms of product development. It could be kind of guiding a startup in terms of different research, or giving your opinion on a product, that kind of thing. So it can really vary quite a lot depending on what the specific company wants support with. In terms of nutrition writing, again, that can vary a lot. It could be writing for a nutrition specific publication, and that could be in print or online or both. It could be writing for a newspaper, a magazine, a website, for your own website. It can be blogging, it can be copywriting for brands and companies. So some people specialize specifically in nutrition writing, whereas for other people, it might be an additional income stream. Online courses as well. So online courses are becoming a lot more common, and it's a nice way to have another service that you offer. So especially if you have a specific niche and you're working one-on-one with clients, if there's an element of education within there that could be rolled out in a group format, it can be a way of having another kind of level of your service. And it may be that it's more affordable for some people in comparison to the one-on-one work. And then again, you have lots of options in terms of, is it pre-recorded? Is it live? Is there an element of both? Do you bring in some group coaching to that program? So there's a lots of flexibility with that as well, or lots of different options really. Then you can also think about webinars, remote lecturing, and workplace wellness. So workplace wellness could be delivering wellness webinars, and that's something that's been happening more commonly during lockdown. But it may also be creating content such as wellness newsletters, or infographics or videos. So really depending on what the company wants for their staff and what's most convenient for the staff. What are they more likely to interact with? Recipe analysis and creation. So that's exactly what it says there. So it could be analyzing menus, coming up with menus, coming up with recipes. Again, adding in our nutritional expertise when a company is working on developing something, or maybe reviewing a product or a recipe or a menu that they already have. It could be media or a social media campaign, and that will vary depending on whether that's paid or not. So again, it's about weighing up each opportunity in terms of the exposure and the connection and whether it's paid or not. And then product development. So I've touched on that in terms of the project work. And it will also depend on the project, of course. So there may be some projects where they need an on-site nutrition professional, whereas in other cases, it may be they're looking for support with research or doing a literature review or maybe giving some feedback on a current product. And a lot of that type of work can be done remotely. So on my next slide, I wanted to talk about some digital tools for nutrition professionals. So again, this isn't an exhaustive list, but it's some of the main digital tools and software that I've found to be really useful when I've been moving over to working fully remotely as a nutrition professional. So the first one to think about really, especially if you're offering telehealth services, is practice management software. So there are lots of different options out there. Of course, Nutrium is one. We have Halixy, Practice Better, Calyx. And what these practice management software solutions offer is really it's a one-stop shop for your telehealth service or for managing your practice. So it would provide things like, maybe booking software, taking payments, your client notes. It may include client communication, such as the Nutrimote app allows, and also maybe reminders and things. So again, it's that streamlining and making the process nice and efficient for both you and for your client. And then I've put video conferencing software under that separately. So of course, the practice management software will either have their own video conferencing built into the platform, or they can integrate with an existing video conferencing software, like maybe Zoom, Google Meet, or Skype. And Zoom and Google Meet are both integrated into Nutrium. Other examples include Doxy.me, WebEx, GoToMeeting, because some people like to use a more maybe a la carte approach where they choose, different software solutions for their different needs, whereas other people prefer to have everything in one in terms of, keeping it all efficient and again, that one-stop shop. So nutrition analysis. So this is particularly useful if you're doing recipe analysis or menu development. Also, if you are going into more in-depth analysis of your clients, if you offer telehealth of their nutritional intake. So this is a feature within Nutrium, and there's other software as well, such as Diet Plan. I've included social media on here, mainly, I guess, because, again, a lot of my remote nutrition journey has involved social media, but I also do think it's a very important focus when we're working online, especially if you have your own business or your own brand, in terms of getting the word out there and building up an audience, and in terms of marketing for your brand, because it's all about getting your ideal client to know you, to like you, to trust you. And as Harriet outlined really well, when you have your client avatar, who you're targeting and who would benefit from your service, then that can be really helpful in terms of figuring out, well, which social media platform should I focus on, because obviously there's so many. I would also say as well, just think about what platforms you enjoy yourself. What are you actually likely to use and engage with as well, because you're more likely to keep it up and create more content as well if it's one that you enjoy yourself. And I'll go on to speak a bit more about that in a moment when we're talking about social media specifically. But there's lots of other marketing tools as well. So Canva is one I use all the time for making graphics, for PDFs, social media graphics in particular. Also for managing mailing lists, there's lots of different software. Two of the big ones would be MailChimp and ConvertKit. And there's lots of social media schedulers as well. So these allow you to create your social media content and then decide when it's going to be posted and then it will automatically be posted. So it's really helpful with that consistency piece that Harriet was speaking about, incorporating some scheduling so that you have some content going out at regular intervals. I would say, though, just as a word of caution, not to only rely on social media scheduling, because the way the social media platforms are designed is, they want human interaction. So if you're scheduling and maybe you're not there to actually respond to comments and that kind of thing, then that might reduce the engagement if you're doing it all the time. But it can be a nice mixture to have some scheduled content and some live content. Other organizational tools. So I think this is just really useful for any online business is cloud storage. So that you have a place to store your documents, and especially if you're working with any collaborators or if you have any interns or staff, so that you can all be added to the same document and give feedback and things. It just saves a lot of time rather than sending emails with attachments back and forth. There's lots of to-do list apps that are really helpful as well. So like Trello and Asana and Pomodoro timers, that kind of thing, in terms of helping with productivity. So they're really just apps that you can set timers so that you're trying to work and concentrate for a certain amount of time, and then you take a break and then you work again for a set amount of time. So those kind of organizational and productivity tools can be helpful, especially when making that shift towards working from home, because obviously the setting is very different. We're maybe not moving around as much as we used to, or there's less boundaries or less structure in the day. So sometimes it can be really helpful to actually impose more of a structure in that way. And then part of the organizational tools may include additional things like booking software, like accountancy software. Again, that will depend on whether you're using practice management software that includes some of those features, or whether you need to look for something separate. And then Mariette covered this really well in terms of the apps for different clients and the broad range of them that's out there, which obviously her Keynote platform is a fantastic resource for combining those and giving you some information. So I won't go into that in too much detail, but some ones are Nutrium, of course. There is the client app. I work mainly with disordered eating, so there's an app that I use called Recovery Record. And then there's, many more, such as the blood glucose monitoring type apps or nutrition tracking apps that are more focused on the actual nutrient intake. So there's loads and loads of apps to consider. And I think it is a really nice additional layer to have in terms of personalizing your service for your clients. And again, it is, meeting those client expectations and just giving them the best service. So you have all these tools available. So my next slide, we are just going to go through some telehealth considerations. So I'm not going to go through this in too much detail because I actually run a full course called the Telehealth Toolkit that I developed with another dietitian called Emily Foster. We go through all of these points plus a lot more in much more detail, but this is just to give you a bit of an overview and a snapshot of some of those considerations, considering that telehealth is a really key area in terms of working as a remote nutrition professional. Obviously, it's not what everyone does. It's not part of everyone's business or income, but it is a very significant area. So thinking about the GDPR, so the General Data Protection Regulation, is really important. So this is the strictest privacy and security law in the world, but it applies to processing data in the European Union and in the European Economic Area. So how that impacts us as nutrition professionals is making sure that we are processing and storing client data properly, and making sure that we have correct business processes in place so that we're auditing, how we're managing this data, that we are obtaining consent from our clients correctly and explicitly, that we're dealing with any potential data breaches as well. So that is a really important consideration for anyone who handles data, personal data from clients in Europe. Services and fees. So that's another key consideration. So thinking about, well, what do I offer and what are my fees, of course. And this is something that can obviously expand, the more experience you get and the more you explore some of these different software solutions and some of these different options that are out there, it's likely that you might, start adding on to your services or starting to tweak them, the more experience that you get in that area. Marketing is obviously a massive area, and I know I've gone through some of the software that can be helpful for marketing, but it's, that's a full course in itself, looking at marketing. But it is a really important consideration because as nutrition professionals, we may have little to no training or understanding of marketing. I know in my degree, we didn't have any lectures or anything related to marketing. But if we're working as a remote nutrition professional, we may be working for ourselves, it may be our own business. And you can have this fantastic business or a telehealth service, but if you don't have clients, then it's not really much use. So thinking about that marketing piece is really important. Business processes. So I guess from going through, some of the software solutions that I spoke about, will inform some of those business processes. So it's really about thinking, how can I make my business processes as helpful and as efficient as possible for both me and my clients? So walking through what is the client's journey and asking your clients for feedback, and how are they finding all of the apps and the software and the links and everything that you're using with them. And then also obviously from your own point of view, is this working? Is it saving you time, or is there room for improvement? Because our time is really precious, and the more efficient we can be, it's going to be really helpful for the telehealth service, but for any business overall. The software solutions, we've gone through some of those key options, and that ties in with record keeping. Of course, as our nutrition professionals, that's a really important one because we need to make sure that we are storing our notes correctly, and that also, again, they're user friendly, they're accessible, and we can save ourselves a lot of time depending on how we're taking our notes as well. So, if we can be taking notes while we're speaking to a client, perhaps, rather than having to spend maybe 10-15 minutes after a consultation to take those notes. So obviously, again, that will depend on your preferences and the area that you're focusing on. Communication and body language, really important as well. So Margarita covered this earlier in terms of the differences of working with somebody in person and via, Zoom or via a video consultation. And it is very different. And you can get used to it, but I think some of the really important points is making sure that you can see and hear each other as best as you can, because you're already limited. You can already only see maybe heads and shoulders. So making sure that your client can hear you clearly, that you can hear them, that you have a backup plan if you can't hear each other properly. And hopefully you can see each other as well if you're using video consultation. So some of the additional things in terms of communication, it can be, really being a bit more aware of some of your facial expressions, of your tone of voice, sometimes maybe exaggerating that slightly, obviously making sure you're doing that in an authentic way. But just to make sure that you're optimizing your communication with your client. And as was mentioned earlier on, to, check in with them regularly to make sure that they are understanding, what you're saying and that you're on the same page. And the last point there then is around multidisciplinary team communication. Again, as working online, working remotely, it can feel more isolating, especially if you're not working as part of a bigger team. But it is really important to make sure that you're communicating with all the relevant health professionals. So it may be your client's doctor or their psychologist or their therapist, and making sure that you make those communication links, and that you're all communicating efficiently, with consent from your client. So the next slide, we're going to move on to the third main focus of this talk, which is around social media for remote nutrition professionals. So I've been on social media as a nutrition professional for over 5 years now. And for me, it's been really, really transformational, really, in terms of my career, and it's opened a lot of doors. As I said earlier, it started out really as a hobby, as just something that I enjoyed to do, and it opened a lot of doors in terms of consultancy options and building up a brand so that I could launch my telehealth service as well. But I think it is important to think through some of the pros and the cons. And this will be very individual, but I've highlighted some of the key points here to think about. So, in terms of the pros, a really significant one is, of course, building up a brand or your audience online. As I said, in terms of marketing, in terms of marketing online, it's a really key area to focus on. In terms of other job opportunities as well, so I've had quite a few opportunities related to the media or consultancy work from people finding me via social media, and it's where the majority of my telehealth clients find me as well. So that may not be true for everyone. So obviously, there are lots of other ways of marketing your services and getting the word out there. But if you have a remote service, then it's likely that your ideal client, will be interacting with things in an online setting as well. So there's likely to be a social media platform that they engage with. Virtual networking, that's been a really key part of it for me. So again, when we're working remotely, especially if we're not working as part of a bigger team, then we can get a little bit more isolated, or we can just end up working by ourselves most of the time. But having your virtual colleagues that you can speak to, you can run ideas past, making sure you have some clinical supervision as well as appropriate. Um, that's been really important for me. And also, building connections with people in terms of working together on partnerships for different products and courses. That's been a really important part. And I guess the reason I started on social media was around flying the flag for evidence-based nutrition. And I think that's a really important pro to highlight because, just getting our messages out there and being able to share that with a wider audience is a really important benefit of social media. Another one I think is that we can develop new skills and we can get a bit more creative. So, of course, we have our nutritional skills and expertise, but being able to develop new skills and be able to expand our abilities in that way, and it could be as simple as learning how to use reels on Instagram, or starting a mailing list, or learning how to make a graphic, like an infographic related to nutrition, for example, or maybe managing your website. A lot of these things can seem like really big and difficult, but again, if we tackle them one at a time, we can absolutely do it. I really wasn't a very techie person to begin with, but just the more exposure I've had to these areas, it becomes much more easy as you progress. But there are definitely some drawbacks to think about as well. Anyone who has a social media account, I'm sure, knows that it can be really time consuming. You can just fall down this social media hole where you don't know where time has gone and hours have gone by. And that can be compounded if it feels like you're working as well. If it feels like, oh, well, Instagram is part of my job, so, it's fine if I spend a few hours a day on here. So setting those boundaries to take care of yourself and to preserve your time is really important. It can also be daunting to put yourself out there on social media. Of course, there is that risk of getting some negative feedback, or, making a mistake in a post. And I would say that any kind of fear related to that, it does go down with experience. And also, we're not perfect. I've definitely made mistakes in posts, and it is okay to delete a post, to apologize, to update a post, just to make it clear that actually, sorry, there was a mistake here. Um, and I think that's part of, well, is just, showing that you are a human on social media. So obviously we do our best to be diligent about what we're posting. but we don't need to put an unrealistic amount of pressure on ourselves either. So bringing it back to the time spent on social media, of course, that can be harmful for mental health. And again, if you're using social media as part of a business strategy, that might be, you're comparing what you see other maybe similar nutrition businesses, they're posting these reviews, or they're working with this client, or they're getting this many likes. And, you might start to compare yourself or where you're at with other people. And again, that can take its toll over time. So trying to, again, set some boundaries, and it might be, only being on social media on certain days, or for a certain amount of time each day, or for certain time blocks. But that can be really important just for taking care of ourselves. We also need to be very diligent about adhering to professional and ethical boundaries. So it's not really a con, because of course it's a really important thing that we need to do, but it can feel like extra pressure as well. So I'll talk about that in a bit more detail in a moment. But again, just to mention that that does start to feel more natural the more practice that you get. And then that risk of negative feedback or trolling. So in my experience, being on social media now as a dietitian for over 5 years, this is fairly rare, that you get negative feedback, but it does happen. Trolling is much more rare. So where there's, maybe a person or a group of people that are, basically bullying you online or trying to take you down, that will be much more rare than maybe a keyboard warrior, which would be somebody who is just very passionate about an area, maybe disagrees with you, maybe does so in a disrespectful way. So that's where, maybe even having a specific policy where you say, I don't interact with disrespectful comments. And, I'm going to delete this post I'm going to delete their comment and block them if that happens. So you always have that option as well. So as I said, in my experience, that's quite rare. But it's good to be aware, obviously, that you can get negative feedback. And when we look at social media overall, for me, the pros absolutely outweigh the cons. It's been a really good experience for me overall. But I think it is important just to recognize that everyone's different and has a different relationship with social media. So it's really worth weighing up the pros and cons for you and making your own list, because obviously, depending on your circumstances, there may be something else to consider as well. So looking at nutrition communication on social media, first of all, if you're new to putting yourself out there as a nutrition professional, specifically on social media, I always say just focus on 1 or 2 main platforms to begin with. Don't overwhelm yourself. Even if you have lots of personal profiles on different social media platforms, if you're bringing this in as part of your job basically, or as part of your brand, then I would say begin with 1 or 2 main platforms, and you can gradually expand that. So just for example, I started out mainly on Facebook, and then I gradually got an Instagram account, or sorry, it was Twitter first of all, and then I eventually got an Instagram account, and now Instagram is my main platform. I've dabbled in other areas like YouTube and TikTok and things, which I don't really focus on or spend my time on. So you can definitely experiment, but I would just do it gradually and focus on 1 or 2 to begin with. Adhering then to legal and professional guidelines is, of course, very important. This will really vary depending on the country that you're in and who your regulatory body is. So, for example, I'm registered in the UK, so my guidelines to follow are from the HCPC. I'm also a member of the British Dietetic Association, and they have a good social media policy document that is really helpful. And then there's also the advertising side of things in terms of the law, so the Advertising Standards Agency. So that will really depend, obviously, on where you're based. But I would say that not every country has social media specific guidelines. It may be that you have like professionalism guidelines, but they don't always mention social media. And if they do, it may not be very detailed. And if that's the case, then I would say check out the British Dietetic Association social media guide, because it's quite applicable just to nutrition professionals across the board in terms of social media. But what it really comes down to, all of these guidelines, it's focusing on respectful communication, confidentiality, and adhering to advertising law. And that's really around transparency. So being really upfront and being clear if a post has been paid for or sponsored, using your hashtag ad at the start. And then in terms of responsible and ethical content, that's something that I think comes quite naturally to us as nutrition professionals, because of course we'll be focusing on our messages being evidence-based and within our scope of practice. An important point to mention there is making sure that, we're not giving individual advice, or that our posts aren't seeming to diagnose someone's problem. So we're not saying that if you're getting these 2 symptoms, then you have this condition and this is how you eat. Because of course, we don't know who's reading that post, and we don't know the full picture. We haven't done that full assessment. And the same thing is true that if people start to contact you and say, I have heart disease, how many biscuits should I eat per day? That obviously we have to be very clear with those boundaries, that I can't give you individual advice if I haven't done a full assessment. So that's just something to mention as well. In terms of communication style, so, Harriet was talking about this as well, in terms of, first of all, identifying your ideal client or creating that client avatar, and then grading your language as appropriate. So a good tip I was told was to think of a specific person. So if your target audience is more the general public, then think of a friend, a neighbor, one of your clients who kind of represents your ideal client, and target your language towards them. So what kind of words would you use if you were trying to explain this concept to them? What maybe metaphors would you use? How would you make it clear? And the same thing would go if your ideal client was maybe another nutrition professional. You would think of a specific professional or a colleague, and you would think about, okay, what language would I use and how would I explain this to them? Similarly, then, the way people interact with social media is generally quite fleeting. So although we spend a lot of time on social media, the way most people are on there is, it's scrolling, it's quickly scanning posts, it's not always reading them in detail. So having clear, digestible chunks of information rather than, a big rambly post is generally more easy for people to understand, and having kind of an overall summary as well. So whether that's in the post or in a graphic, just trying to keep it all as clear as possible. Sometimes when we're simplifying nutrition for social media, we can run the risk of obviously oversimplifying, and that's where we can signpost to additional information as well if necessary. Again, in terms of that communication piece, the graphics is important. So if, especially, I'm thinking about Instagram in particular, because that's my main platform, and that's a very image-based social media platform. So having graphics that are attractive but also accessible, so making sure that people can actually read them and interact with them, is really important. So some of the main tips I've had in relation to graphic design is making sure that you leave enough room to breathe. So around any text, around any graphics, so that there's not too much kind of squished into the one image. And then a bit of it is subjective and just playing around, moving things around until it looks good. And there's also plenty of templates that you can use. Well, I'm thinking of Canva in particular, which I use, and then you can just adapt it to make it a little bit different, or to add in your logo or your brand colors. But in terms of that accessibility piece, the main piece of advice that I would share there is your contrast ratio. So what that means is, if you have a light background in an image and you have text on top of it, make sure it's a dark color. So you don't want a light color on a light background, or you don't want a dark text on a dark background. You want to have enough difference between those two. And that actually just makes your content more accessible to more people who may have different visual needs. And the key point really about nutrition communication on social media is showing some of your personality and bringing in some elements of storytelling, because people engage with other people. They don't engage with robots or, a big kind of corporate image. So if you're really trying to connect with people, then it is, being authentic, and it's always walking that line of trying to be engaging yet professional at the same time. And I think that's absolutely just a learning process as we go. So my next slide just summarizes the key take-home messages from this talk. First one being that there are many remote work opportunities for nutrition professionals. This is expanding all the time, especially with the events of the past year. And it is bringing up some more opportunities as well in terms of flexible working from home. And this is something that I see all the time, because the work I do with Nutrimote, we're often looking up jobs to see, right, what remote nutrition jobs are available, so that we can share this with our Facebook group and in our newsletter. And we are seeing more and more come through, which is really positive to see. Second point being that finding the right nutrition software to support your remote nutrition practice really helps with efficiency and with establishing your services. So it is really important to think about, okay, what's my processes? How is this working? And is there any other technical solutions that's going to help me to make this more efficient, but also to take my service to the next level? And as I said, if you're focusing on telehealth in particular and you want more information about that, then myself and Emily Foster, who's a dietitian and a marketeer, we run the telehealth toolkit. And that's one of the prizes that's being given away today at the end of this session. So check that out if you're interested. Just to mention about that it is mainly focused around the UK and Ireland in terms of some of the specifics and the legality. But the broad strokes of it can be applied to most nutrition professionals. And then the third point here is around social media. So social media can play an important role in building a brand and virtual networking. So they're really two of the key benefits that I've experienced from social media. But it is really important to weigh up the pros and cons for you, to set your boundaries as needed, to take care of yourself, because it's not all roses in terms of social media. There's pros and cons. So just have a think about that for yourself. So thank you very much for listening, and thank you for Nutrium. Thank you to Nutrium for inviting me today, and be very happy to answer some of your questions.
Thank you so much, Maeve. It was great having you, and you really just gave so much insight and really great feedback on everything about social media. It's so important, and you did a really great job. And I think there's a lot to learn, and yeah, I think it's great. And because we actually have a whole bunch of questions for you, so I hope you're ready.
I'm ready.
Okay. The first question we have is, can you suggest any software for online courses that e-learning offers?
So is this to build an e-learning course, or is this to do an e-learning course?
I think maybe if there are any options for online courses for e-learning, I think that's kind of what the question is asking.
Oh, so for CPD basically, so for remote learning online, is that it?
Yeah, I think that would be fine.
So there's loads of different options. Actually, we have a full remote CPD guide that anyone who signs up to our newsletter gets automatically for free. But some of the key ones to think about, so some of the webinars, so NutriWeb, they run regular webinars related to different areas of nutrition. And there are a lot of other ones as well in terms of podcasts. So, you have Sigma Nutrition. Alinea Nutrition is a great one. That's a subscription service that provides more deep dives related to nutrition science. Examine.com and Examine Personalized have lots of different snapshots as well of research summaries and deep dives. And actually, Alinea Nutrition does webinars as well related to different areas of nutrition science. So there's loads of actually options out there, and they're again, there's more and more of them coming through. So in our weekly newsletters, if there's anything coming up, so there's one from the UK Ethnic Dietitians Group, for example, coming up related to nutritional diets. So yes, that's kind of a one-off one that's coming up soon. So yeah, if we just, I guess it's hard to summarize them all because there's so many. But yeah, some of those ones I mentioned are great.
Okay, that's awesome. Thank you so much for sharing that. Another question is, how can you replace the physical examination during the remote consultation?
Yes, good question. So it's definitely different, and it will depend on what your service is. As was mentioned in Margarida's talk earlier, that some people may actually start to move more towards a non-diet approach, or maybe not focusing as much on the anthropometry. So for example, that's the way that I work with a lot of my clients. But if there's somebody who's more high risk and needs that monitoring, a lot of it is kind of developing that contract with the client, because it may be that they need to self-monitor and then send you that information. There are apps and things that you can use, or like digital scales and that kind of thing, that you can link up with your client and you can see their measurements that they're taking. Another one though is getting that information from directly from their doctor or another healthcare professional. And sometimes, it depends. You might need to actually kind of coach that client in terms of how to take those measurements as well, if they are needing to do that. And also just this subjective piece of, actually looking at the client as best you can through the computer screen, to see, do you see any risk factors? Do they look like they're, losing weight, gaining weight? That piece, you can get a glimpse of that, I guess, but obviously you can't really get the full picture. So it is different. And that's where I think having a discovery call before engaging with, having that client as part of your service can be really helpful, because you can outline kind of what's expected, or, where the limitations are in terms of this is an online service, so we can't actually monitor those measurements. And that's where you have to build up that kind of relationship of trust as well. Or as I said, possibly communicating more closely with other members of the multidisciplinary team.
Right. Absolutely. That is definitely true. So thank you for sharing your thoughts on that. Someone else wanted to know, how did you decide on how to price services for project work when you first started working remotely?
Good question. So I did a bit of market research. Basically, I asked some of my colleagues, and because really I didn't want to undercut the market. That was one of my worries, that especially when I was starting out, if I didn't feel confident, pricing something too high, but I also didn't want to undercut people too much and, devalue our service as a whole. So I asked around, and also I'm a member of the Facebook group that Harriet mentioned, the freelance RDs group, that's run by Anne Wright. And they do a survey of their members, and people say like, what is their hourly rate? And then there's a graph that you can see kind of what's the range. So that was really helpful as well, to see kind of what are other people charging in general. And I started out, I guess, on the slightly lower end, but within that range. And then the more experience I got, I started to increase that as I felt comfortable, and as my experience increased, basically.
Absolutely. Yeah, it's awesome to actually have resources like that to turn to. And I love that, you feel comfortable enough as a dietitian to ask other health professionals, nutrition professionals, and that they're willing to help provide that. I feel like the nutrition community is so great, and they are so helpful, and they're all so kind. So it's great that we even have that kind of resource to turn to.
Absolutely.
So another question is, do you need to be registered in different countries to work remotely with patients from different nationalities?
Yeah, that's an important one. So it will depend on your professional indemnity insurance or your medical malpractice cover. So I'm registered with the British Dietetic Association, and my guideline is that I can work with people around the world, except for if they're based in the US, Canada, or the Cayman Islands. But I need to make it clear to them that I'm a UK registered dietitian. So that needs to be on all of my correspondence. So that's how it works for me. And it's from other countries, I've heard it's quite similar, but you would just need to check with your insurer specifically to say, check your documents or check with the insurance company. Are there any limitations to this? Because, for example, I was UK registered and I moved back to Ireland to work for a little bit. And I couldn't actually call myself a dietitian in Ireland until I became registered with the regulatory body there called Coru. So there are kind of technicalities like that. That's why it's important to be clear that, okay, this is where I'm registered, and also knowing the countries that you can't work in, because even within the US, people within like a dietitian in New York, can't work with a client in California and that kind of thing.
Absolutely. Yeah.
Yeah. So that is an important one just to check. But also actually related to that, you may be able to get an add-on. So I have heard of some dietitians who work more internationally. There are some covers that claim to be international. I haven't actually, spoken to the nutrition or the insurance companies about that. And you may be able to get an add-on to your current policy that will allow you to work in more areas. And again, it probably depends on the type of work you're doing. So I would say just reach out to your insurance provider to check about that.
Yeah, definitely all makes sense. Another person wanted to know what your favorite client apps are.
So I love Recovery Records, the one I mentioned, because the clients I work with, it is around disordered eating, and I like that it's not about tracking nutrition. It's around kind of thoughts, behaviors, regularity, prompts, and then I can also interact with my clients in there. For my clients who aren't working with me, if it's more kind of general nutrition rather than disordered eating, if they're lower risk, then I've also used the Nutrium app, which has been really good. And yeah, I think they're the main ones actually that I've used. I haven't had as many specific requests from clients to say, I work with this app, can we work with this together? I have had a few clients using more of the kind of the more traditional, just like nutrition tracking app that they can use by themselves without having a nutrition professional involved. Sometimes that can be useful, but sometimes actually that can feed into disordered eating in particular. So sometimes actually I'm discouraging that. I've also worked with clients where we make a more sort of bespoke spreadsheet. And so it's like a shared Google sheet. And because if they know that like these are the specific things that I want to track, then we can come up with that together. And that's worked really well with some clients as well.
Awesome. Yeah, that's great. Another person wanted to know if you would still use Facebook and consider it as an effective tool. They said they have an Instagram page set up, but not sure if they should focus on Facebook as well.
Yeah. Yeah, it's really interesting. So as I said, Facebook used to be my main platform, and that's really changed now to Instagram. And I think it was around a lot of the changes that happened to the algorithm a few years ago, where content just wasn't being, people weren't seeing it basically, even if they were following me. And I think it was also, I was just enjoying Instagram more myself, and I just kind of got wrapped up in that. So I think it depends what you're using it for. And if you have an Instagram account, you can quite easily link a Facebook account to that. So every time you post on Instagram, you can automatically post on Facebook. So it's a fairly easy thing to do if you feel like you have the scope to take that on. But if you're using maybe like a Facebook group, so I found Facebook group to be fantastic for Nutrimote. And there's a lot more of a focus on Facebook groups because Facebook wants to promote building communities, and they're adding more features. They've updated that recently enough. So I think the Facebook groups are fantastic. The Facebook page, I think it is worthwhile. It's not where I get the most interactions anymore. But as I said, it's quite easy to link that to your Instagram if you're kind of wondering about it. And you can always try it and delete it if you don't want to.
Right. Yeah, very true. Kind of along that same topic, do you have any advice for recent graduates for engaging with social media?
Yeah, so I guess it depends what you're looking for. So is it that you want to follow nutrition professionals kind of for your own CPD, or is it that you want to create your own platform or your own page, to promote nutrition messages? And if that's the case, I would say, I guess the tips I went through already in terms of, picking your platform, like where do you the people that you want to contact, like where are they hanging out on social media? And then I would say just don't put too much pressure on yourself, just gradually chip away at it. And that consistency piece that Harriet mentioned is important, but make sure you're setting a realistic goal. So maybe it's posting at least once or twice a week to begin with. And then if you do any more than that, then great, that's a bonus.
Mm-hmm.
So they'd probably be the key things I think about is, okay, like what do you want to get out of this? Where do you want to focus your attention? Go gradually, and don't put too much pressure on yourself, and set those boundaries as well in terms of how much time are you going to spend.
Right. And kind of going along with that, do you think you should focus in on a niche?
Yeah, good question. So this is something I went back and forth on over the past few years, because I was quite general for a while, and especially like dietetically speaking, it was quite general nutrition communication, and it was mainly about promoting evidence-based nutrition, fighting fads. But that kind of led me towards the disordered eating area, because it felt like kind of a logical progression of that, kind of the harm of diets in general. I found it niching down to be really beneficial. And I know all the business and marketing advice is generally to niche down. I found the positives that I found from it is you can just really focus on this one area. You can just feel more specialized, more confident. And again, it makes the marketing side of things easier because you know who you're speaking to as well. And it takes some of the pressure off, basically.
Right.
So I've found it to be really good. But it does depend, because like in different countries, there's more of a need for like general nutrition input. Whereas if there's more competition in another country, then maybe actually having something more specialized can be helpful.
Right.
And I guess the thing is as well is, if you're unsure, you don't have to push yourself into a niche. It's something that you could be thinking about, just keep the door open to that possibility, see how you go. And most likely you'll start to discover basically what area you're most interested in.
Exactly. So kind of going along that line, would you say like kind of when you niche down, it's easier to create that content and like also be kind of organized to create that content as well?
Definitely. It does make it easier. I think one of the fears about niching down is that you're going to be limiting yourself. But if it's that whole thing about if you talk to everyone, you're talking to no one. So I think, starting out general in a nutrition career and, overall is quite normal. And it's just about, putting your feelers out and getting your variety of experience. But I do think as you progress, focusing on that niche, it just means you can really specialize much more, and you can just really connect and help specific people.
Right. So when you decide to niche down, do you actually need to have a lot of experience first? Or if you just became like starting off a nutrition business as a recent graduate, is this something that you can still do? Or do you need to say, I have 5 years of experience doing X, Y, or Z?
Yeah, really individual. Like I know people who've done either approach. I don't think you need, say, like 5 years experience in an area to niche down. I think a few years as a nutrition professional in general, if you're not sure, will help you to give you the time and space to figure out, okay, what do I actually want to do? But some people just know from the get-go exactly what they want to do. And if that's the case, then I guess just make sure that you actually feel confident positioning yourself as an authority in that area. So, have you had any experience? Are there any training courses you need to do? But I think, if you feel confident starting to share information on that area, if that's within your scope of practice, then you can absolutely just go for it.
Okay. Awesome. And we have time for one more question. So hopefully that's okay.
Yeah.
One person wanted to ask, when managing your private practice or working remotely, what do you find is the best way to communicate with other MDT members in regards to patient management?
Mm-hmm. Yeah, it's quite individual depending on the MDT member. So sometimes, like myself and a therapist might both be using the recovery record app with the client, so we can all communicate via that app. Email is probably the most common way. Of course, you're getting permission in terms of to speak with these other healthcare professionals as well from your client, so you're getting that consent. Phone calls as well. So often it's connecting via email to then set up the phone call or the Zoom call to have a discussion around that. With GPs and doctors, I tend to find it's writing a letter. So actually, I tend to just I'm typing the letter, but I actually send a physical letter most of the times. But what I tend to do is ring up the practice and ask how do they want that communication to be. So it's a lot of, I guess, kind of phone call, email, unless I'm linked up with them on a specific app.
Right. Okay, well, thank you so much for answering all those questions. We still have a few more, but we can definitely save them more for the debate whenever we have Harriet and Margarida and, everyone else kind of join. So thank you again so much for your time. And with that said, we are actually going to move into our 5-minute break. So we are going to take a quick 5 minutes, go ahead, get a drink, a snack, whatever you feel like is necessary. And then we will come back after 5 minutes and we will go ahead and have all of our speakers today sitting with us and just answering a whole bunch of your questions. We have had a lot of questions come through for the debate section. So please come back and join us. We are really excited with how this is going. We hope you guys are enjoying it as well. And we will see you guys in a few minutes. Hi guys, welcome back from our short little break. So we are actually going to continue on our webinar with some questions for our guest speakers. So we have had quite a few questions come in, and I'm just going to be directing questions towards all 4 speakers. Of course, if you have any additional questions, please feel free to leave them in the Q&A section. This portion of the webinar is slated for about 40 minutes. We can definitely go a little longer, maybe even a little shorter depending, but we're going to try to aim for 40 minutes here. So if you have, again, any questions, leave them in the comments. But I think we're doing pretty good. So let's go ahead and get started. Are you guys ready for all of the questions that we have? Okay. So we need to have Harriet's mic unmuted. Okay, I think we're good. So the first question is for all 4 of you guys. So we would love to know your thoughts on social connection online versus in-person interaction. In a world where COVID has forced us to move everything online, where does that leave the human need and that the scientific base for our need to connect with people that are all like-minded for a well-being journey? I hope all that makes sense.
Yeah, I'm happy to give some thoughts on that. So I think, online communication, I don't think it replaces in-person communication, as I'm sure most of us have been recognizing through the lockdown. And I haven't looked at the specific data about this, but one of my psychology colleagues was speaking to me about this around how impactful in-person communication is, compared to online. But I do think it's a really useful kind of backup option in terms of communication, but also in terms of those who need more flexible approaches, and in terms of what we've been saying about nutrition coaching and actually the added level of support that we can offer when we incorporate technology and online working. So I guess human connection as a whole, I don't think it's a replacement, but in terms of nutritional input and nutrition support, it really works for some people.
Yeah.
Yes, I would agree with that. And I think it's very important, again, to really identify how people want to connect. Yeah, some people prefer actually that everything is promoted, and other people actually prefer, coming into a clinic. And so in this current situation, I think I think people want to be connected more than ever. I think people want to talk more than ever. And so I do think that moving forward, the human connection will always be there as an important part, but it's important to identify how do people and how often people want to be communicated with. And that is the key to kind of personalization, the service or the program that you're offering.
Yeah, absolutely.
I think as well with social media, I completely agree when the way we communicate is really important, because if you think about, and I actually posted something recently about, the Insta stories, the reactions, because we communicate through this kind of weird ways of communicating, which is reacting to an Insta story or liking someone's post. And sometimes what I feel working in social media, and I do set a certain time to reply to messages because I think it's important, and also it shows that you are actually interested in engaging with the people that follows you, which is very important. But on the other hand, sometimes I feel from the other side, people feel that they can sometimes show not being as friendly or not being polite because they are behind a phone. And that's something that I do struggle. Sometimes people coming and asking me questions without even, showing the basic of, hello, how are you? Like, because we are people, like we are communicating through technology, but we sometimes miss the human side of, of us, isn't it? Like I do struggle sometimes, but in order to overcome that and manage the situation, because I still carry on doing my job in social media and communicating with people, I tend to answer the way I would like to be contacted, if that makes sense, like being not too nice, but just showing some humanity and actually talking openly about these things.
Yeah, I would agree with Margarida. I think it's really important to, think about how your client wants to be communicated with, but also let's not underestimate the importance of those small talk, for example. So if you're beginning a call, whether that's with a patient or with a company that you're working with, this is something that I've really tried to be doing during lockdown, especially. Spend the first 5 minutes or so on that call catching up on small talk, so asking how their day's been and actually saying, how are you? Because I think a lot of us have been struggling during the lockdown, and that's a way to really connect on a personal level with the person that you're working with. I think it's also important, especially in this digital era, to note down small details about the patient you're working with or the company you're working with. For example, have they got kids? Do they live with other people? Do they have a specific hobby that you're aware of? And show a bit of an interest in that as part of that small talk. I would also say, I think a lot of us are experiencing Zoom fatigue. We're spending a huge amount of time on these Zoom calls, whether that's again with patients or meetings with companies. They are very draining, and I think that can also perhaps affect the one-to-one connection with other people. So making sure you're setting boundaries and taking regular breaks away from your screen is important too.
Absolutely. And that actually leads right into the next question we have, is how you can promote yourself on social media, like Instagram, for example, because we've talked about how that can create a huge amount of anxiety. But if you don't have the time or the money to invest with PR, you know, like kind of where can you set that boundary? How can you really do that? This may be a good question here for Harriet, but I mean, all of you guys are on social media, so this can definitely be open for all of you.
Now, I might answer that in an interesting angle, because actually I don't use social media very much for my business at all in terms of marketing. A lot of the marketing that I do is in terms of networking and getting on Zoom calls, having email communication with clients, checking in with them often. So I do use social media, and we are active on all the platforms. I set very clear boundaries. I try to, as much as possible, not work in the evenings or at weekends. I think if you can afford to, and if you don't enjoy social media, then do outsource that work, whether that's to an intern or someone else on your team, or set very clear days and times that you're going to be posting and engaging on those platforms. And that comes back to the point I was making about consistency with your communications and marketing.
I agree. My social media account is not my main role. Like I do have a full-time job, so it kind of helps to manage this, because it's not my big source of income. So I completely understand that other colleagues spend a lot more time working on social media, but I do feel like I need to set some boundaries as well, and that will be setting a specific time to answer messages, or I don't always have a schedule to post certain things, but I do make sure I have certain times where I will be focusing on researching for a post or podcasting, for example, which is really time consuming, making sure I set those boundaries. Otherwise you keep being connected, and if you've got a few messages you kind of tempted to answer. So I do tend to, because it's still, in the end, I might use social media for personal reasons, but that side of things is professional. So I need to work as a professional and set that timing for work purpose.
For sure.
Yeah, I'm also not very big on social media, and I think I do delegate it to my team and focus just on one platform that is most relevant to my business. And we are very consistent, we're very frequent, we have a very kind of clear messaging. What I do think, though, is that, especially to Maeve's kind of presentation, is that people sometimes are too scared to start, and that can sometimes put them off. And I do think that when I started, I was very scared, and I put up my first blog, and I thought I was going to get hate mail and all these kind of things. And just to reassure you that does not happen. People will not all of a sudden, bombard you with nasty comments and things like that. But if social media is one aspect where you think you can start getting your message out, and you need practice, choose one and do it, because it is kind of a part of life. It shouldn't consume you, it shouldn't consume your day, but I do think that having some focus, setting some time aside, having the boundaries, being frequent but not being scared, is definitely part of that.
Right.
I definitely agree with that. And I guess also to add to, if you're talking about marketing on social media, is that generally people won't really engage with accounts that are just constantly marketing at them or, advertising services at them. So I think it's that balance as well of sharing different updates, sharing that human connection piece if you can, where appropriate. And then also, adding in like a testimonial or an offer or a service or an update, but just getting that balance so it's not just constant advertisement as well.
Absolutely. And so would you say, in order to help kind of reduce that anxiety, along with everything else you're saying, is probably just to not be obsessing over your numbers on social media? Because I think, and you can correct me if I'm wrong, but I know that you can fall into the trap of really comparing yourself to what other people are doing. We've already talked about it a little bit for that. If you're always saying, oh, I haven't hit the 10,000 mark on Instagram yet, like I have to do it, then it can really, I think, increase that anxiety and then make you more upset about everything. And then it just kind of spirals. So, I definitely think if you are consistent, like what we've, you guys have all been talking about, and, you have a plan, like the numbers will eventually come. They may not go super fast, but you will, have a presence on social media. So yeah, that just, social media is a crazy world right now.
Absolutely.
So I guess another question that we have here for you guys is, what is the role of nutrition professionals in achieving a more sustainable future in the UK specifically?
Where to start?
What I don't actually understand it fully. What does that mean? The sustainability in terms of the nutrition profession, or what? I don't, unless somebody else clearly understands the question.
The environmental sustainability?
I don't.
Yeah, it's not really specified for the question, so we can, just kind of go with that and see where it takes us.
Okay. So I'll start. So for me in particular, the whole area of personalized nutrition especially is very linked to the advances in technology, but also the societal impact that we need to consider in terms of not only what we eat, but how we shop, where we shop, and our dietary patterns. So I think in terms of where nutrition professionals come in, we need to have a wider understanding. We tend to be incredibly good on the science and then not so good on the politics, the inequality, all the other social impact, the societal factors that really determine how people can afford the accessibility to food, who gets access to healthcare or access to information. And so I think for nutrition professionals, it's really our role to be very, very aware of the wider implications of why people choose certain foods and how they can shop, and how we can play a role in helping people to access those nutritious food, even the free apps that can raise their food and nutrition literacy, and then eventually help to connect that in the end, with farmers or pharmacists, and in that way make the future one of more sustainable one in terms of food nutrition as well.
Okay.
I agree, and I can give my experience, because I used to work as a dietitian in Portugal, and there's clearly massive differences between the way I used to do things and the way I do right now. And obviously I'm an acute dietitian, so I have that side of things working for the NHS. I think mainly here we are very good at treating, but not so much at prevention. And nutrition plays a massive role in terms of preventing certain conditions. And also, I completely agree, the social side of things. For example, after COVID, there was like a lot of noise around the nation people need to lose weight to prevent COVID and stuff like that. So I just think the messages from the government and the public health messages need to be we need to consider them and focus on other things that usually we don't really look at, like social aspects and education, rather than blaming people for being obese or whatever that means. Do you know what I mean? I think we need to focus on little things and working with people directly in the community and preventing and helping them and educating, rather than focusing on other things that usually, I just feel like sometimes we don't consider certain aspects and we just go straight to the certain task and some shame, which I think it's general. It's not only in the UK, but I think we definitely need to work more in education and prevention.
Yeah, and I think that conversation, though, has really been happening on social media more recently, which is great to see, in terms of how can we make the profession more inclusive, and how can we be more inclusive to our clients? And absolutely those conversations around shame and stigma around weight and body size and health. So yeah, it's really important to consider.
Yeah, and I'd agree. I think since the coronavirus pandemic, we have seen an increased recognition for the importance of evidence-based nutrition, especially in the UK, whether that's through the government campaigns about nutrition and health and weight loss, but also on social media. A lot of debunking has been going on about cutting through myths and fads about, you know, certain vitamins, supplements, and immunity. And that has indirectly helped to increase awareness of the nutrition and dietetic profession, which, as we know, is relatively small in the UK compared to other healthcare professions. I think we still have a way to go, but initiatives such as Dietitians Week in the UK is a great way to champion our profession. I also think there's been a lot of controversy recently about whether healthcare professionals should work with brands, especially food industry. And my personal belief is that we should absolutely be collaborating with them and helping to steer them in the right direction and promoting evidence-based nutrition. Otherwise, they're going to go off and work with other nutrition people who are perhaps not qualified to be advising on those sorts of topics. I don't know, Maeve, if you have any more thoughts on that topic, perhaps?
Yeah, I think it is really important as well. I guess you can look at the argument from two ways in terms of social media messages specifically, or kind of working in the background with brands. And I've heard, you know, different arguments related to this. I think it's great that that conversation is happening, and I think we do need to be really careful and, you know, be really considerate about the brands that we're working with. But I do think, you know, we don't want to close that door, because if you think about the reach that brands have in general, you know, we can have a bigger impact with a wider audience if we're there engaging in the right way. And I think that hopefully we're going to have some more guidance on that in the UK soon.
Absolutely. Well, that's all wonderful news. Thank you guys for your input on that. I think it's great. So another question we have from people is kind of talking about like a legal cover or insurance, really, if you are working as a remote nutrition professional. So what kind of legal cover do you recommend for an online private practice that covers you as an RD, life coach, yoga therapist, et cetera, you know, especially as you are seeing clients around the world? And then on top of that, you know, do you kind of have a ballpark idea of something like the cost of what this would be on an annual basis? Or is that kind of just dependent on, you know, where you're located and what you do?
Yeah, I think I could begin perhaps by talking about in the UK specifically. So we have GDPR data protection rules, which came into force a few years ago. And as a health professional running your own business, it is your responsibility to make sure that you implement the appropriate data protection rules within your business. So I encourage you to look at the ICO website, make sure you're registered with them as a professional, and make sure that you have relevant documents in place, such as a privacy policy, website terms and conditions. If you have a contact page on your website, the client should be able to opt in, for example, for receiving marketing from your company. Again, if you're seeing patients, they need to be signing consent forms. They need to be aware of your client terms and conditions. In terms of how you go about getting these documents in place, there are a few different routes that you can go down. One route is that you can try and educate yourself on these topics, work with recommended templates online. The downside of doing that is that if they're not drafted by a legal professional, you could potentially be using documents that are not up to scratch and don't cover you enough. Another option, of course, is to go and pay a legal professional to help you to create those documents. That can be a more expensive option, which I appreciate not everyone has the budget to do when starting out. What I did when I was working as a clinical dietitian, I collaborated with another freelance dietitian in the UK, and we together paid for a solicitor to draft some template documents for nutrition professionals, which we now actually sell to other nutrition professionals as a sideline business. And these are just template documents that people then need to modify depending on the services that they offer through their business. But the benefit of working with the solicitor is that we have that peace of mind of knowing that we have the right documents in place, which I think is so important.
Mm-hmm. Yeah, absolutely.
And just related to insurance, when you're working remotely as a nutrition professional, so the main thing that you need is your professional indemnity cover. So if you're, again, a member of the British Dietetic Association, that'll be included. I'm not sure if that's included with other regulatory bodies in different parts of the world. It is in Ireland as well, for example. So just making sure that you have that professional indemnity or the medical malpractice cover. Other types of insurance. So if you're fully working online, then you're unlikely to need public liability cover because that's really for the in-person work. If somebody was to trip over or to hurt themselves, in your clinic or at a talk that you were giving. But another consideration may be business insurance. Again, you can speak to your insurance provider to get more information around that. And I know that the question was around as a life coach and yoga instructor as well. So I'm not too sure if your professional indemnity insurance as a dietitian would cover you for all of those areas. So again, I would say just speak to your insurance provider. And the other thing is you can speak to an insurance broker if you're looking for cover.
I have nothing
Great information
to add.
Yeah, that's all super great. It's very informative, very helpful. Thank you guys for that. Okay, so another question we have is regarding meal plans versus like specific meal plans. So it's like some nutrition professionals prescribe like very specific meal plans, but lately there seems to be kind of a trend which focuses on just giving the patient general guidelines. So do you guys have thoughts on that? Anything along those lines? I guess it wasn't necessarily a question, more of just like a discussion point.
I'll take that one, and I think this is a very topical issue. I think when we were studying, we always were taught to give like a 3-day plan together with your goals or the agreed plan that you were going to give your patient. And I think that time is gone now, because I think if you give your patient or your client a generic 3-day plan, and say, well, you should eat like roughly this or generally around this and go shopping for these kinds of things. People don't want that information. And so they kind of expect a meal plan that's personalized to them, according to their taste, according to their budget. And this takes money and this takes time. And so I do think that professionals should include this as part of their package. But in order to make their own lives easier, they need to have like a Nutrium access that can create that meal plan for them. And so I don't think that it's something that people even look at, at come week 2. Nobody wants to start a new recipe every day, and nobody eventually wants to follow a meal plan. But the expectation is there that the meal plan is personalized to them. So my feeling is consumer demand, and the tools are there for you to save your time and keep your sanity, and use the tools that are available.
Yeah, absolutely.
I guess, sorry, carry on?
Yeah, yes, go for it.
I think in my experience, I really like to work in a non-diet approach, because I think that's what makes me better in myself from an ethical perspective. But that's a whole other conversation that we could leave for another webinar, about whether diets really work and how we need to change our approach, because and that's something that we definitely learn in uni. I've learned that we needed a meal plan, and I think, for example, nutrition professionals in Portugal work a lot with diets and meal plan, because that's what we see. And it's interesting because since I moved to the UK, I'm much more exposed to terms like intuitive eating, like non-diet approach, and other ways of working with clients, which makes a lot more sense for me, especially considering the fact that I like to work with disorder eating and eating disorders. So in that perspective, I think we are not prescribers, first of all. So we are there to support our clients. And that could be whether, some colleagues will work with meal plans, and that's okay. And there's specific areas where these meal plans can definitely apply. Like, for example, if you're working with athletes or people that really have certain nutritional needs that need a bit more guidance. But generally speaking, I think we are working towards a more non-diet approach and helping people to achieve healthy behaviors more than following a certain type of rules. And I think that's something that is changing a lot within our community of dietitians and nutritionists. So it's something that we don't really learn in uni, but it's something that we are changing. And we, again, in social media, we've been talking a lot about this such hot topic, I'd say.
Right. And it'll be interesting to see kind of as things progress with the universities to see if we start to begin to talk more about like the intuitive eating and the non-diet approach, because right now, you know, that is such a topic, and it'll just be interesting because like you said, in university, you just talk so much about the meal plans. So it'll be interesting to see how kind of that transitions going forward, because there is just so much more than just one meal plan fits all.
Exactly.
Okay, great. So another question we have for you guys is, how can you increase your client retention rates?
Great question on that one. And this is something that I'm really big at with HRS Communications, trying to retain clients and especially transition clients onto long-term retainers, because as a business owner, I want that security of knowing that I'm working with clients for a long amount of time. I think part of the way of converting clients to that way of working is maintaining that relationship with them. So checking in with them regularly, whether that's sending them an email, arranging a Zoom call, or picking up the phone. Keeping that client relationship is incredibly powerful. Again, I think with the CRM system, a benefit of that is you have all the details of past and present clients. So don't close off the door when you finish working on a project with a past client, even if they don't have the budget or don't have the time to immediately progress to another project with you. Make a note to contact them, whether that's in a few months' time. And you don't need to be pushy when you're getting back in touch with them to you know, make a sale, but just show an interest in their company, connect with them, ask them what they're up to. Do they have any problems? Do they need your services? Update them with any updates on your company. You know, it might lead to some work, it might not, but the most important thing is to keep that meaningful relationship. That would be my sort of top tip.
Yeah, I found that, I guess, in my telehealth service, that a similar approach works in terms of, you know, just checking in, like reaching out. And I've found it's helpful to offer different service options as well. So, you know, to have that more in-depth nutrition coaching approach. And some people, you know, love that, and that's great. And other people prefer to have a much more flexible approach, or especially if you have been working with someone more intensely for a while, but then they like the option of just, you know, checking in every now and then once things are actually quite stable. So I find that flexibility piece in terms of your offerings can be helpful. And I guess it's all about your service really, and making sure your service is as valuable as possible, because then people are going to feel good about it, are going to tell other people about it, are going to want to keep working with you. And it's the rapport that you have with your client as well. That's really, I guess, from a telehealth, like a one-on-one point of view, you know, we all have, you know, similar training, but the people connect with different people. So it's often actually that client relationship that makes all the difference.
Yeah, I would say that I changed my business model, especially in terms of pricing, in that my prices are now really based on value. So instead of having an hourly rate or a day rate or a project rate, you look at a value-based outcome and say what values are our clients looking for at the end, which means that you can really position your services accordingly based on the outcomes that they would like to see. And that automatically leads to longer term relationship with your clients automatically. So what I've done with the Kenya platform is we all, of course, have to provide a lot of market insight and intelligence. And so we've transitioned to a subscription-based model as a consultancy, so that people, if they want to get access to the trend reports, the intelligence and the database, for example, they need to be able to subscribe and then, you know, top up for any projects, you know, that is then value-based, based on value-based pricing, to then retain those clients in the long term. And so I definitely think for any nutrition professionals, rethink the way you construct your business model, think about your pricing, and think about the value that you're offering, and how you position yourself within that.
Yeah, those are great answers, guys. Thanks again so much for sharing that. Another question we have is how you can make the jump from more paper-based, old school, I guess for lack of better words, nutrition things that we've been that we had talked about. I know a question came about this earlier, but how can you make that transition from going from like the old ways of doing like nutrition meal plans and that kind of stuff to moving on a digital platform? Do you guys have any like tips, tricks, suggestions that could really help people kind of make that jump and that transition?
Yeah, it's hard to give a concise answer to that because I guess I run a whole course about this. But I think a lot of it is actually just about taking the leap, and it's about giving it a go. You know, what Mariette was saying earlier about taking things one at a time, and giving yourself the time and space to learn about it, and not underestimating your abilities. You know, you're a qualified healthcare professional. You'll absolutely be able to learn how to use this app or this platform. So I think it's about prioritizing things and going for it and kind of chipping away at it.
Yeah, definitely. And I know Nutrium definitely is a great platform for, online nutrition professionals specifically to transition to the digital space. And, kind of from what I've seen with Nutrium and what I know, and you guys can definitely, expand on that a little bit too, but Nutrium has a lot of those tools, and it also has, really great tutorials on YouTube that I feel could also be helpful for people who are wanting to learn more about jumping onto that online digital space. And it may not seem as scary.
Yeah, and I think the having a practical plan could help, so that maybe week one you say, okay, I'm just going to transfer all my records online, and do that. Focus just on that for 1 or 2 weeks, and then the next thing is, okay, now I'm going to maybe set up the like meal plans, or work with meal plans with the next few patients that I have scheduled. So just those patients that are scheduled for that week, and that's how you slowly work up a plan. But don't expect to know a platform, and that's for anything inside out from day one. Start with one thing at a time, have a structured plan, integrate and implement and learn. Then the cycle goes on and on and on and on.
Yeah, absolutely. That is perfect advice. So I guess kind of going along that, again, this is not really a question, more of like a generalized comment. So feel free to, insert wherever you feel like is necessary. But usually a normal scenario is to charge patients based on like an appointment basis. But what if they had a subscription with that same type of profession? So something like a Netflix for nutrition kind of thing. So where the patient would have a package of services per month or year, and not something that's individually set appointments. So any kind of thoughts for, kind of like this generalized comment?
I guess it depends on what kind of areas you work, because if I've got patients or clients that seek for certain advice, and for example gastrointestinal conditions, sometimes I only need to see them once or twice just to give a bit of advice. Some others will need long-term plans, and therefore they need a bit more follow-up and more appointments. I guess it can be interesting or helpful to have a package or something, but also each client will be so different, and our approach will also be different. So it's difficult to make it as a standard package as you used to do, like when you request a PT session or something like that, because it is very different, and the therapeutic relationship, if you want to say it, is very dynamic. So people might need more or less input. So I think for me personally, I think it wouldn't work quite well, but also from an attendance point of view, sometimes getting people to buy a package of 2 appointments help them to turn up, basically, if they are very resistant to come again, if they have any psychological barriers, or if they have some issues in terms of attending and coming back. That could be helpful, but I think it needs to be evaluated on an individual basis, I would say.
Okay.
Yeah, because I think it's a really good question, because I think there are more people moving towards that kind of package, coaching, subscription-based model. And I guess the approach I've taken is I offer it as an option, but I also have the more traditional, like, one appointment at a time. And I may end up moving more towards that subscription model, because I do think there's a lot of benefits in terms of the client retention, and in terms of the value they're getting and the additional input that they can have, and also about the client commitment as well to to really focus and prioritize on this area. But I think and it also comes down to the financial side of things and what people can afford, and sometimes you can make those package options more affordable, or you can have payment plans. So I think it's really good to explore. I'm still I guess, exploring that area and starting to introduce it. And I'm finding it really useful that I have introduced it, but I'm still kind of have one foot on both sides, I guess.
Yeah, definitely.
Yeah, I agree. It is the future, but we also have to be inclusive. And so having those diverse packages, having the different options available to people is going to be crucial. And I do think that coming back to, again, what is the value, positioning your value as what does it mean if you have that subscription? What can you expect? What can you expect from me? What type of help? What type of outcome? What kind of tests are we going to do? That is kind of, I think, where the important communication comes in. And I think the younger generation will run with the subscription because they are way more interested now in nutrition and reading labels. They are more aware, but we shouldn't exclude any other groups who want the traditional, write it down on a piece of paper. That's absolutely fine. And we should serve everybody.
Yeah, absolutely. Another question we have is, what is the best type of way for nutrition professionals to access clients, gain clients, look for new clients, that kind of thing? Do you have like a specific area that you're looking for? I know Nutrium has a marketplace that you can search for different professionals. So do you guys have, thoughts, suggestions for that?
The BDA, for example, has a freelance website where you can look for dietitians depending on the area that you're looking for. So that can be an option. There's like some certain areas of nutrition that, for example, if you are a FODMAP specialist dietitian, then you can be included in certain websites like the Monash or the King's College, where people can look for your job and to get an appointment. I guess social media as well has a really it has a great impact on promoting your services and what you can do. So I think that would be the two main ways. I don't know if you guys have any other ideas.
Yeah, that's mainly how I found clients as well. So, I mean, I ask each of my clients where they heard about my service, and the vast majority is social media or Instagram specifically. But I guess that's kind of specific to me and where I focus my time. Also, the SEO side of things, in terms of if you have a website, clients can find you via Google if they're searching for, certain terms that you're talking about, you're writing about. And then, having profiles in some of those different platforms, as you mentioned, that Nutrium has that as an option. Like nutritionist resource is another common one, BDA, as you mentioned. So I think, I guess, getting your name out there as much as you can. And again, it will depend on your service. So some people do really well, speaking to their local GPs and, maybe teaming up with like a yoga instructor or somebody where you might have a similar client base. And again, fostering those relationships. So I think that's been, the main areas that I've explored.
Yeah, I would just add to that, SEO is incredibly important. And alongside HRS, I continue to run Surrey Dietitian, which is a clinical dietitian freelance business. And choosing the name Surrey Dietitian was based on SEO. I thought, if I was looking for a dietitian in Surrey, which is where I lived at the time, what would I type into Google? And that's how the name evolved. And I continue to run the business. I actually refer the patients onto another dietitian on my team. I don't see any patients anymore. But we continue to get a large volume of inquiries each month, purely through the website. I don't advertise on the BDA anymore. I don't advertise on social media, but the website alone generates a huge amount of inquiries that often result in bookings. I would also say, if you're interested in working with businesses in terms of finding those opportunities, check job postings in your local area, websites, but also connect with other freelance professionals. I know in a lot of the professional Facebook groups, for example, we often pass on opportunities that we can't do ourselves for whatever reason. And there's always opportunities available if you chat to your colleagues and friends. So I'd recommend that as well.
Yeah, those are all really great suggestions. Another question we actually just had come through was, obviously right now the economic climate is quite difficult with COVID and the pandemic and just kind of everything going on. So do you ask your clients to pay what they can afford while keeping in mind the reduced income for many people that you could be working with?
Yeah, that's a service I've just introduced more recently, is like a pay what you can option. Um, I had to look at, I guess, my business structure and the hours that I'm working and that kind of thing to figure out how I could do that specifically. So what I worked out for me, and from speaking to some other dietitians who offer this as well, is having a limited amount of time per week that you can allocate to a pay what you can slot, and then just think about, what the minimum is for that appointment. I think it is often a good idea to have a minimum, even if it's like £5 or £10 or something, because it really increases the likelihood that someone's actually going to show up for that appointment, rather than just booking it in. So I do think, in terms of, if that is an option that you can offer for people on a lower income, I think it's great, because again, we're just being more inclusive, and a lot of people are really struggling and need the support that we can offer. But obviously it will depend on your business and whether you can offer that. But obviously you wouldn't want your whole business to become that, that's really going to impact your time and the amount of money that you can make. But if you can allocate maybe a certain amount of time, I think it's a good thing to do.
Yeah, great. And then we can just maybe do one more question and kind of wrap this up, because I know you guys have just spent so much time, and it's been amazing having all of you here. So we'll just kind of do one more question. This one person has said that she has been, he has been trying to set up their online practice since the beginning of the year. And their biggest challenge is that not one single software offers everything you need for client management on the clinical side and on the admin side when it comes to booking and all of that kind of stuff. So you guys have suggestions on, like what a platform would be for them to use or look into, or, anything like that to really kind of boost their business and get them off the ground?
I think Nutrium has a lot of things on that, the admin side, in terms of booking. Obviously that won't include, it actually includes, I wouldn't say sending letters, but sending emails. So I think you don't have usually you don't have the perfect situation. It's something that you always need to use one more than a platform, or one platform and then using your email to communicate. I mean, I think I appreciate it's challenging, but you often don't find the perfect solution. But I think Nutrium has a really tools to do your admin and your clinical work.
Yes, I totally agree.
If you go to a different setting, as I work for the NHS, I've got different softwares for different things. So definitely, I think Nutrium has everything there.
Yes, I would agree that and I see a lot of them as well, is that many of them don't have all the bells and whistles. Because if you start building the bells and whistles from the beginning, you might be building bells and whistles that people don't need or people won't use. And so therefore, from a provision point of view, it's always important to build as you require those features. And so yes, it may be that you need to add a few here and there, but the bulk of it, and you always have to think of privacy as the first thing. Your data should be protected, number one, and the rest can be on the fringes. You can add that on as a separate maybe later on. But yes, I do agree that in terms of Nutrium, it would provide you, especially if you are starting out and new. You always also don't want to make sure that you don't invest too heavily in something that has got all the bells and whistles, and then you don't have a client. So you want to make sure that you grow also with the technology, and therefore having an option as a starting point as you are newly to the business and the industry, that you start with what is already available.
Exactly. Okay. And I guess to help with that, if you are kind of deciding between different platforms as well, is writing out, well, what are your main priorities, and in order, and see what's the best match, even if there are maybe certain things that you still need to add on here or there. And the other thing is, I'm an affiliate for Nutrium, and they've been really receptive to suggestions, and I know they always ask for feedback. So if there's something that's missing as well, I think whatever platform you're using, I'm sure they'd be more than happy for you to reach out with that feedback, because each of those services obviously want to make the best product that they can as well.
And I would just add to that, if you're looking for additional add-ons, for example, a CRM system or perhaps a management system for your own business as opposed to managing your patients, I would always talk to other nutrition professionals before you go ahead and make a financial commitment. And I've learned this through past experience of perhaps spending money on things that weren't best for my business. Whether that's through one of the professional forums or Facebook groups, just send out a message and get feedback from other people, because they've probably been in the same shoes as you and they've probably been through that process and will have some useful learnings to share with you.
Mm-hmm. Absolutely. Yeah, definitely use as many resources as you can. It's really great, again, that we have such a great nutrition profession around here, and that, all the dietitians in the community, are just so helpful, and even all the other nutrition professionals. It's really great to see all of that, coming from America, being so invested in the American market, and then seeing, you guys from the UK and even from Portugal. And, it's just so great that all of us from across the world, we all have the same ideas and the same values. And I just think that's really cool. But thank you guys again for spending so much time with us today, and really just, sharing all of your knowledge. And it was so informative and so helpful. And I hope everyone watching and attending this webinar has really found it helpful as well. We are really excited to just have you guys around. And also, as we just kind of close out this webinar, please note that we will be sending emails to all of you who are participating with the webinar, and we will be sending a recording. So that way you guys can go back and listen to what, the other speakers had to say again, and just take notes in case you missed something. So no worries about that. Also, I just wanted to remind you that the results of the giveaway will be announced next week over on Nutrium's social platforms. So please make sure that you are following them over there to see if you are one of the winners of our 3 prizes. And with that said, we all hope you guys have a wonderful, safe, nice weekend. Hopefully it's relaxing, and it was great having you all here today. So thank you so much for attending, and we look forward to, maybe doing more of these in the future.
Thank you.
Thanks. Bye.
Bye.